All right. Welcome back once again. Muziki kutoka DJ Omoshfire, DJ Machachari Mleta Habari. And we want to welcome you back again. Karibuni tena ndani ya OneMic Show. Na ni furaha kujiunga nanyi wapenzi wasikilizaji, nikiwa nimekuandalia taarifa za kusisimua, muziki wakata viungo na kindumbwe cha siasa au politics ukipenda. We are streaming live on Facebook from Kilimanjaro Studios outside Washington DC, and we are now live on YouTube. So please share and call all your YouTube friends. Please remember to subscribe to both our YouTube and Facebook pages at the OneMic Show, and then follow us on Instagram and TikTok at OneMic Show. We are also taking live calls tonight, so I want you to write down this number. The number is 202-683-4570. Press star 5 to speak. Again, the number is 202-683-4570. Press star 5 to speak, so save that number. Now, despite billions being spent on prescription medication, chronic diseases keep rising and women continue to suffer silently through menopause. But what if I tell you that the food on your plate could work better than the pills in your cabinet? Now, Dr. Daphine Kaniaru, family medicine physician certified in lifestyle medicine, will join us shortly to show us how nutrition can reverse diabetes, high blood pressure, and heart disease. We'll also cover blind spots on menopause management and why men must be part of this conversation. So wanaume musiondoke. I want you to start dropping your comments below and let us know where you're tuned in from, what city, what state, what country, what galaxy, and you let us know what's going on. So I want you to tune in. Na bila kusahau, napokea mziki toka DJ wetu Machachari Mleta Habari, DJ Omoshfire, na tunadunda kule viwanjani na Mika Ojezi yake nambari 7 mgongoni akiletea habari za michezo. Na moja kwa moja toka Kilimanjaro Studios ni mimi mtangazaji na mwanahabari wako mpendwa Ali Badawi. Kwetu wananiita mteule na wengine mniite mjukuu wa Masai, because I'm Kenyan by blood, American by design, Masai by choice. Sichagui, sikagui, na sibagui. Karibuni.
Welcome to the OneMic Show.
All right, now this hour we'll be talking to Dr. Daphine Kaniaru, a family medicine physician certified in lifestyle medicine. She's here to show how food as medicine can reverse diabetes, high blood pressure, and heart disease. Dr. Kaniaru will also explain how nutrition can ease menopause symptoms and why men must be part of this conversation. So once again, wanaume, tulizeni boli, msiondoke. And please drop a comment below and tell us what city, what state, what country you're tuned in from. I can see already James Ratemo is tuned in. Anasema Huagambaya, we are tuned in. I can see Luis Muya is also tuned in. Karibu sana. And then pale YouTube, sijui kama watu wa YouTube tayari wameingia. We're going to check out people on YouTube. The number to call is 202-683-4570. Press star 5 to speak. Again, the number is 202-683-4570. Press star 5 to speak. Make sure you share the link on all your WhatsApp pages, on your Facebook pages, on your Instagram pages. Kila pahali. Let everyone know that we are live, we are direct, and we're coming to you the way you want us to come to you tonight. Now we're going to get started right away because we have so much to unpack tonight. And tonight we dive into matters about health beyond just trimming bulging waistlines. Billions are spent annually on prescription medications, yet chronic diseases keep climbing. Women across the world are walking through menopause in silence, dealing with hot flashes, sleepless nights, and rapid weight gain. To most men, menopause is only seen as the end of fertility, but rarely understood as a critical turning point that can impact the health of women for another 30 plus years. Now, the big question tonight is, what if the solution of these health related issues associated with menopause lies not in another prescription bottle, but on the food in our plates? And that's where our guest comes in tonight. She's a board-certified family medicine physician based in California. She's also a certified in lifestyle medicine and is on a mission to help prevent and reverse the big 5 killers: diabetes, hypertension, heart disease, obesity, and high cholesterol. Her pure plant-based diet solutions are radical to some, but life-changing to others. Some say it's too extreme, while others say it's the future of medicine. But one thing's for sure, it challenges everything we thought we knew about health, aging, and the taboo subject of menopause. So ladies and gentlemen, boys and girls, please drop your favorite emoji in the comment section and help me welcome, all the way from California, the bold, the passionate, the controversial Dr. Daphine Kaniaru. Dr. Kaniaru, karibu sana to the OneMic Show. Can you hear us?
Yes, thank you so much.
Okay. All right. Karibu sana. How are you feeling so far today being on the OneMic Show?
Wow, wow. This is amazing. I feel like I'm in the studio for real. And yeah, I'm ready.
Okay. All right. Asante sana. Now, before we get started, Dr. Kaniaru, I want us to get a lay of the land at the most basic level. Now, of course, you can see this is a male-heavy panel with an audience that's at least also 50% male. Menopause to many is seen as simply the end of fertility or of women no longer being able to conceive. Maybe, Dr. Kaniaru, tell us what we might be missing from this narrow perception of menopause, especially amongst men. Dr. Kaniaru.
Right. So, like you said, it's not just cessation of periods, because if it was that simple, then actually most of us will be happy. Like, why do I have to deal with periods? Forget that, right? Well, but that comes with a heavy cost, right? It's your heart health that is going to be affected because you lost your estrogen and progesterone and even testosterone, because women also make testosterone, right? So you're losing all these hormones because basically when women are born, you have all your eggs. It just comes to that time of the month, your egg is released, but they are all there when you're born, right? So they get released and the count keep going down. So by the time you approach or when you get to menopause, you don't have any eggs, right? So that's what's happening. So your hormones that you need, because you need hormones, right, to be able to release that egg. You need hormones to be able to implant that egg into your endometrium, right, the inside of your uterus. So all that is gone now, right? Or it declines. And then, of course, finally, it's really, really low. It's gone. So this is where problems start, because these hormones were not only making you fertile, but they're also supporting your blood flow, right? Your blood vessels. It was supporting your bone health. It was supporting your mental health. Of course, your sexual health. It was supporting so many other things, your skin, right? So there's so many other things that are being supported. So once this goes away, for a lot of women, it becomes a problem. And this is the thing. It's supposed to be a natural process, right? So if you think about it, menopause is not just, it's not just a point in life that you get to, and you get to menopause and then you move on, right? Like, oh yeah, I just got to menopause and then just move on. No. For some women, in fact, it takes anywhere from a few years to a decade of perimenopause symptoms, right? So they will start with hot flashes, they will start with mood changes, they will start with, low sexual drive and all this stuff for even a decade before they even finish their period. So perimenopause can last that long, a few years to even a decade. And then what defines menopause is that point where you haven't had a period for 12 months. It has to be 12 months. No period at all. So at that point, you call that menopause, right? And that happens about average age 51. But think about menopause happening from age 45 to 55. Average 51, right? So you could be anywhere in there. So you get to that point, your period stop, and then now you start the post-menopause period. And this is, this can go on, it goes on for the rest of your life, right? And there's symptoms that actually get better when you get to post-menopause. Like the hot flashes can start to improve, maybe like your mood and stuff, but vaginal dryness actually continues to get worse. Your desire to have sex will continue to get, if you don't, as a woman, you have that discomfort because now your estrogen makes things moist. There's the discharge that gets produced that's now is gone. So there's dryness, there's the skin, wrinkling and all this happening. So for a lot of women, they stop having intercourse. And the moment you do that, guess what? It's going to be hard to do it. So as women, what we encourage them is that, you need to go through it. You need to, get a lubricant, get vaginal moisturizer. Or if it's so bad, some women need estrogen, vaginal estrogen. Something needs to be done. Otherwise, some women, they don't have the desire. They feel, they're dry, they get hot, right? That's what you were talking about. Men need to understand what's happening.
Mm-hmm.
They want to have intercourse because it's hurting her. She doesn't have the desire too. So those things, right? So those symptoms can worsen. Getting urinary tract infection, because again, that estrogen protects that area. The muscle, even just the pelvic wall strength, you lose that too. So you will find women having what we call prolapse. Prolapse just means things falling out of place. The bladder can fall out of place. The uterus can fall out of place. Yeah, I've seen women in the clinic who come in and they're like, there's something bulging. There's something bulging out, So you check it. It say that their uterus has fallen because they don't have that strength. They have lost the how do you call that? The elasticity of the pelvic floor, so things can fall out of place. So there's so many things that are happening, and like I said, it's your heart, your bones, osteoporosis becomes an issue. It's your mental health, your cognitive health as well. So there are so many things. It's not just periods.
Wow, what a powerful start. The number to call is 202-683-4570. Press star 5 to speak. We're talking menopause today. And of course, we're talking to Dr. Daphine Kaniaru all the way from the state of California. And I want to quickly come to studio and just, get to introduce the panel that's also going to be part of this conversation. Remember, the number is 202-683-4570. Press star 5 to speak. The number again is 202-683-4570. Press star 5 to speak. In studio, I'm going to start here. Right beside me is DJ Machachari Mleta Habari, DJ Moshfai. You were enjoying that music from him. So from that intro from Dr. Kaniaru, DJ Machachari, what is your expectation tonight?
My expectation tonight is that I'll be able to go home a much more informed and understanding individual on this subject called menopause, as to how it affects those around us, and be able to be a better spouse, companion, friend, understanding male, should I say other half, or understanding male in terms of what happens to the woman when she's, I'd say over 50, but this happens with people who are even less than 50. But, I'd say with women over 50. And based upon the intro that was given, now I'm starting to understand some things that I have seen.
That you did not know before.
Even relationships. And another chap called divorce.
Wow,
But
okay.
Let me keep my mouth shut.
Yes, and I think another important part that you mentioned is at what age should people, especially women, start preparing to manage this, and at what age should also men start being prepared to know that these changes are going to happen with your woman. Is it because it's normally associated with maybe the 50s, the late 40s, but we're going to find that out, if that's the age, or maybe if preparation should start maybe a little bit earlier.
Boss, this thing, even I think hapo 35 inaweza anza kuingia sasa, mtu anza kujipanga.
No worries at all, we're going to find that out. But let me go to also Mika. Mika, kama unatusikia, like from that powerful intro from Dr. Kaniaru, please let us know what you expect tonight. Mika Och, twende kazi.
Hi, good evening, everybody. And want to thank Dr. Kaniaru for joining us today. Thank you for blessing us. What I'm expecting is getting to be more understanding on what and how, and the science behind, and how to be able to be a more compassionate, understanding, caring, and loving person to the people in our lives who will go through this, and who, as Omosha Mesema, hopefully that when we understand, when we leave the show today, we become better partners, spouses, fathers, friends, brothers, sisters, but in understanding, but also getting to learn on ways on how we can reverse some certain ailments in our bodies without taking a lot of medicine, or even just naturally, in a way which improves your lives. And as she said, we usually been told health is wealth. It's simple as that, right? And if you want to know how wealthy health is, just look at how much people spend to treat these ailments.
Okay, asante sana Mika Och. We also have, who's also going to be remote today, we also have OneMic. Now, from a conversation we're having earlier today, OneMic, you were asking about the stages of menopause that especially men need to be wary about with their spouses and with the women in their lives. So, Uno, karibu sana, and tell us what's on your mind on this topic and what you expect tonight. OneMic, twende kazi.
Karibuni, asante sana, Doctari. Listening to your intro, I definitely heard you talk about the 1 year without any period. But I think also for us guys, in preparation for this show, I was doing some research for myself, trying to understand. So I know there are various stages. There's premenopause, perimenopause, menopause, and then postmenopause. And I think maybe if you would get into that, so that even as we can get educated, and what happens during peri, because I think when that transition is happening and there are a lot of things going on, because if you ask most of those guys in the studio or most of the guys out there, they just know menopause is menopause and that's it. That why is it really like this? We are get menopause. So I think this conversation is really, hopefully, it's going to open us. Let us see beyond, the hot flashes, or see beyond the anger, or see beyond the irritability and what it's causing. And as it has been said, in preparation, it's being forewarned is being forearmed. Is it being forearmed is being forewarned? One of those. But asante sana, and that's what we hope to, and hopefully, Bandio will pick a thing or two. Back to you.
Okay. Asante sana OneMic. Now, before we go back to Daphine, we also have super producer Mubelwa Bandio in studio because OneMic decided to go remote without warning. But Mubelwa, talk to us. Tell us also briefly what you're expecting to, especially from that powerful introduction that Daphne gave earlier on.
Kwani watu wa Bongo wana menopause?
Jesus.
Oh, sorry.
All right. Expecting a lot. That introduction by itself, I think it's enough to make me start taking notes. I think there's a lot to learn and a lot to educate.
Full scope.
Yeah. So I think it's going to be it's a class. It's a master class tonight. So I'm looking forward. Not only about the issue of menopause, but also how to tackle. Unapotaka vitu na chakula, it's not the easiest way, but it's the best way. Kwa sababu kila mtu anakula.
Yes.
Right. Kwa hiyo ni swala kujua tu access na vipi ya kuandaa na mambo kama hayo. So I'm looking forward. Nachukua notes mimi.
Okay.
Yep.
Asante sana Mubelwa Bandio, and I want to welcome Luis Muya. I want to welcome Kwenye Wanjoroge. They're all here on Facebook, and Christabel Michelle. Please drop a comment and let us know where you're tuned in from, what you expect tonight. And of course, we have our very own Washeke Ndirang. Washeke, you've forgotten to tell us where you are today. We always assume Texas, San Antonio, but we always are wrong 100% of the time. So type up pale chini tuambie pali uko and where you'll be tuned in from.
Kwa ajili ya msiba wa
Chalikak.
Yes.
Okay, sawa. I confirm, like that is that's not according to the OneMic Show. That's according to Mubelwa Bandio. But Washeke, type up or confirm. I can also see Tabitha Njeri is tuned in. Karibu sana. Thank you so much. I can also see a number of people of YouTube tuned in. Please type in the comments and let us know what you're thinking. The number to call is 202-683-4570. Press *5 to speak if you want to ask a question directly to Daktari. Now, Daktari, back to you. You had some of those things that have already come up from the panel in studio. Part of it is because we just don't know what we don't know. There was the issue of, it starts when a woman goes through 12 consecutive months without having her monthly period. And then there's a question of at what age does it start? Is it a certain hard age? When should the preparation start? So Dr. Kaniaru, I'm going to give this back to you.
Right. So, and unfortunately, like you said, as chronic diseases have become more and more now, women are also getting into menopause earlier.
Oh, wow.
You know why that's happening? Because, if the body is not healthy and there's a lot of inflammation, it actually destroys. It's going to destroy your eggs, basically, and you're going to get into menopause earlier than expected. So it's not like, one age for everyone. That's why I said, from 45 to 55, that's normal, but expected. I'm just telling you, expected that it's going to happen earlier and earlier. And sometimes, sometimes women have conditions that put them into premature menopause, right? So they might have had a surgery of the, especially pituitary. So pituitary gland is at the bottom of your brain. And it's the gland that controls all the glands in your body. So think your ovaries is another gland, your adrenal glands, your thyroid, right? So if you have surgery in that place, or some people have tumor or whatever, so you can get into premature menopause or surgical menopause, right? So some of these things can happen. Some people get surgery where their uterus and ovaries are removed for whatever case, right? They might have had cancer, they might have had, tumors and stuff. So those, of course, are exceptions. But in general, for women, it's not one age for all, right? Like, oh yeah, at 45, you start seeing this happen. Even though, yes, if you get menopause under 45, you are considered premature menopause, right? So you can start to expect it from age 45, and it's not going to happen like I said, right away. So that's the premenopause, or kind of the stage preparing for the menopause itself. And the symptoms at this age, they will get the hot flashes, maybe not every day, right? Here and there, they're getting hot flashes, their moods, their periods too. They get irregular periods. So they can get a light period this month, 2 months later, they have a heavy period. So they will go through this, and that's preparing. So if you see this stuff happening, if they haven't had cessation of their periods and it's irregular, so it's starting to happen, right? So you start to get prepared. But that can take a while, right? It can take a few years, but it can take as long as even 10 years, which is, kind of sucks, right? That's a long time. But yes, for you to really call it, now I'm in menopause, to say for sure you're in menopause, you have to be without periods. So you stop that irregular stuff going on. Now you truly don't have periods for 12 months, for 1 year. Then you can for sure say that you're in menopause.
All right. Okay. That is Dr. Kaniaru. Number to call 202-683-4570. Press *5 to speak. So a lot of nuggets and knowledge being dropped here. And I'm sure this is information that especially a lot of men who are tuned in might be coming into contact with it for the first time. Despite, like being a brother, being a sibling, being a husband. And that's why we're doing this. I have Arthur Kocheng here. He's saying he's watching from Ruaka 254. Waya iko sawa, karibu sana Arthur Kocheng. And then Christabel Michelle Bunde tuned in from Delaware. Karibu sana Christabel. And you should also come along to the studio. Delaware simbali sana. And then Arthur Kocheng bado natuma salamu to the OneMic crew. Now Esther Mulusa ameingia na fire kama kawaida. Esther Mulusa anasema sounds rather alarmist and generalized to me. Those symptoms sound very dire. People go into menopause at different ages and have different levels of effects. Mulusa reporting from Greensboro, North Carolina. Aya, Mulusa ameingia. Mulusa is in the building. Leo hayuko kule kunaitwaje Shimalabandu. Yeah, that one right there. Hayuko huko. Alafu na washeke hapa anasema tuning in from Numea. Now, I don't even know what country that is. Tell us at least. Numea. Noumea. Please tell us what country that is. And then one of our favorite, audience members is also tuned in, Kenya Njui. And Asema, allow me to ask this question. In fact, before I read Kenya Njui's question, let me actually read Misha. Misha, yuko pale YouTube. Misha anasema, greetings from Estonia to the OneMic Show. So, wow. Dr. Kaniaru, people are listening to you from Estonia. Wow. Anasema ujambo na shikamo. And then we have Patricia Williams. Patricia Williams, anasema Patricia Kilburn from New York. And we welcome you, Patricia, to the OneMic Show. So a lot of people already tuned in, so people are very curious about this. Now, Kenya Njui hapa anasema, allow me to ask this, and I'm not being insensitive. Given that menopause is not a pathology, so to speak, but rather a normal process of aging, why is this a point of conversation? I recognize that it comes with its challenges, but this is not unique to just a group of women, but all, right? Why does it merit a conversation? So Kenya Njui asking, and I love, and this is why I love the People's Kamkunji, because people speak what's in their hearts. you know, ni kwa nini mnaongea juu ya menopause?
You actually read that question.
Yes, indeed, and it's a valid question.
Utarudi kwako.
It's a fairly valid.
But utarudi kwako.
Kenyanjui is the one. The good thing is that Kenyanjui is the one who asked that question and not Ali Badawi. Back to you, Dr. Kaniaru. What can you tell to Kenyanjui?
You know, I love that question. Why are we even talking about this? This is a natural process. Why are women getting hormone replacement therapy when this is a natural process? Like, you understand what I mean? Like, I totally understand what he's saying. And this is the reason. Remember how we were talking about food to prevent and reverse diseases? Guess what we are dealing with? Overweight, obesity, things that actually predispose our bodies not even to tolerate things that are supposed to be normal, right? So when women are overweight and obese, when they get this menopause, it really hard on them, right? They're already having some mental problems already, right? They may not like how they feel, how they look, right? Because think about it. Having all these issues with overweight, obesity, and maybe that they're already dealing with high blood pressure, diabetes, and all this, that's not easy. They're already dealing with a lot. So adding this on top of it, which is supposed to be a normal process, it becomes really hard. And the thing is, when you have excess fat in the body is not just there. It actually produces inflammatory compounds. And this inflammation doesn't only affect, just your body, it affects your brain, it affects your mental health. It affects everywhere in your body. So we're having all these issues. And also, this fat is also producing estrogen. And that estrogen, remember how we say that menopause is decline and, almost completely no estrogen in your body. So you have all this excess fat in your body, and you're making excess estrogen. So you're a woman who is reproductive age and you're pumping out all this estrogen. You get into menopause and you have all this, excess fat still producing all these, hormones that basically just mess up your body. So I think that the big issue we have is that we don't have healthy bodies. Let me just say it like that. We don't have healthy bodies. We don't have healthy minds to face these called natural processes. Because if you didn't have all this, right? If you're exercising, you're eating healthy, you have healthy weight, you have health, you're strengthening your bones, you're from exercise, eating foods that are rich in calcium, your mental health is pretty good, you're not drinking alcohol, cigarettes, and all this stuff, you can be able to handle these things, and you can name it, all the other stuff that is going on, issues in marriages, in our relationships, and everything else, the stresses, right? So this is really what makes this process become really hard on some women. But let me say this though, this doesn't mean that every woman who is going to go through, of course, we will go through menopause, right? That they are going to need some intervention of some kind. It doesn't mean that, but many will need either some serious diet intervention or some medication intervention, some hormone replacement therapy, or they're going to be pretty miserable.
Okay, and we're going to be talking about all that stuff later on in the show, including the hormone replacement therapy. But I think Kenyanjui, let us know, type and let us know if that answer to your question was satisfactory. This merits a conversation. And Apa Christabel anasema, thanks Ali, I will certainly come to discuss matters mental health. Christabel, I will put you to task on that. We'll talk about that later on. And then Washeke anasema, sounds so dismissive about a stage in life that affects women's health and quality of life. So yes, so a number of comments coming in here. Kenyanjui bado yuko hapo, but before I go to Kenyanjui, let me see if what people on YouTube are saying. There's quite a number of people here that we have tuned in on YouTube. I have the Africana Voice. The Africana Voice says, Dr. Kaniaru is a fountain of knowledge and a treasure to our diaspora community. And then Patricia Nasema, Dr. Kaniaru was my church sister in a California church. So yeah, watu wa church pia wameingia. So yes, so a lot is going to be happening tonight. We are very excited to have you, of course, Dr. Kaniaru. And then of course Kenyanjui here is giving another comment. Kenyanjui says, to narrow the conversation here, what we are discussing is not menopause per se, but the effects of poor food choices and how better choices can mitigate early menopause or early menopause, plus other related lifestyle choices like diabetes and cardiac issues, correct? The conversation is not about menopause itself, a normal aging process. So, okay. Sawa
Sasa
sawa.
yeye ameconclude show.
Kinyanjui anaona mbele, you know, like he's reading he's reading ahead of the teacher, but hiyo ni sawa. But I want to remind all those who are tuned in that you're tuned into the OneMic Show. I'm your host and producer, Ali Badawi. We are talking to Dr. Daphine Kaniaru, a family medicine physician and lifestyle medicine expert from California. She's here breaking down how lifestyle and nutrition choices can reverse chronic diseases. We'll shortly shift to the topic of, or rather, maybe we'll continue the topic of menopause. We'll also explore why it's more than just a woman's issue and how nutrition plays a role in easing symptoms and why men need to tune in this conversation as well. So want you to keep it locked for that and more. And please drop a comment below. Let us know what you think. Also in the comment section, please type yes or no if you believe food can truly reverse chronic diseases. Hapo tu kwa comments, yes ama no. Unajua kuna watu wanapenda dawa. There are people who have this big medicine cabinet and they say, I'm very healthy. Look at my medicine cabinet. It has 275 different types of medicine I'm using, and I'm very healthy.
You need to be prepared and stocked.
Ndio hivyo sasa. Ukienda kwa medicine cabinet unakuta kila kitu hapo.
Wengine wetu we were scours.
Ndio hivyo sasa.
We were taught to be prepared.
So you had all kinds of medicines, you know, Tylenol,
I still have
Panadol, Cafenol.
Where I will remove it.
Okay, sawa sawa. So so type in the comment, let us know if you believe food can truly reverse chronic diseases badala ya madawa. Our lines are open. The number to call is 202-683-4570. Press star 5 to speak. 202-683-4570. Press star 5 to speak. We already have a caller. Oh, wow. Again, number to call, 202-683-4570. Press star 5 to speak. Already we have a caller who maybe has a comment or a question for Dr. Kaniaru.
2658. Hello.
Okay. Let us know your name and where you're calling from.
Yes. Hello. This is Esther Mulusa reporting from Greensboro, North Carolina.
Talk to us, Esther.
I just have a comment. First of all, I want to congratulate Dr. Kaniaru. This is a very important topic that is never discussed, at least in my opinion. Maybe people might prove me wrong. Most mothers, African mothers, will not tell you about menopause. They don't want to spoil your innocence. They don't want to, the teenage, teenagers feel very optimistic about life. They will not tell you about menopause. So you come and just accidentally fall into it. Now, I had an experience because I had chemotherapy in my mid-30s. I had breast cancer and I had some very harsh chemotherapy administered to me. And that harsh chemotherapy actually put me into early menopause. It was very, very harsh. But something miraculous happened. My body bounced back. The doctors could not believe it. They were in awe, like, how did that happen? Because you never come back to normal functioning. But I am one of those people. So I'm one of those people who didn't know why mothers used to carry little handkerchiefs, the older, it was to wipe the sweat because it puts you into these heavy sweating modes. I remember I was a student. I was doing my doctorate and I was also teaching. And I remember I would stand before students and just in the middle of nowhere, I would break into a sweat. My face would, drops of water just falling from my face. And you see, young students don't know what's happening and they would burst into laughter, The students would laugh and I wouldn't know what to do. I had to have a handkerchief or little towel to mop up all the sweat. I was going through chemo. I was going through, early menopause. So it's a very distressing time. It is something nobody really prepares you. I don't know how many African girls have been prepared for menopause. I used to see white women, when they reach a certain age, they cut their hair short. After women were allowed to keep their hair short. And I wondered, why do they prefer the short hairstyle? It's because of the sweating, It is better when you have a short haircut because, your neck will get wet and all that good stuff. So I just want to really appreciate her for bringing this awareness because these are things that are not discussed. Nobody will tell you. Can somebody please call and prove me wrong? Nobody will tell you that this is what's going to happen to you one time. You'll be sweating all night, Sometimes you really want to have fun. The next minute you're hot. The next minute you're cold. So I went through that process, but miraculously I bounced back. So I just wanted to say that, and I'm grateful for Dr. Kaniaru. It's just that she scared me the way she started off. Those symptoms sounded a little, extreme, because different people experience different things. People get into menopause earlier than others. Some women give birth in their 50s, that means they're not in menopause. So people are kind of different. So that's all I wanted to say. And thank you very much. I don't know if I'm clear. I don't know if I can be heard.
Yes.
But thank you.
Yes, of course. We heard you loud and clear, Esther. Asante sana. And I want, real quick, Dr. Kaniaru to react to, what you just said, because these are things that, to be honest, a lot of us men are coming into contact with for the first time. I've heard about, the hot flashes, but I didn't know exactly how it looked like. You're just standing somewhere in school and then you're suddenly sweating and all that. A lot of people do not know. So Dr. Kaniaru, maybe just react to what Esther just said, and especially that concept of where she said that she bounced back. She experienced the symptoms, but she bounced back. So what exactly also does that mean? I'm gonna, let you speak, Dr. Kaniaru, and then I'm gonna let Esther say something for 1 minute, and then we're gonna continue. Dr. Kaniaru.
That is really, really amazing, what Esther is saying, because if she, she had symptoms of menopause, right, or premenopause, having those hot flashes, and that definitely, when she said she was going through chemo, because we all know how damaging that can be, and that must have been the effect of the chemo. And somehow we thank God that her body recovered. Like, she was able to get her ovaries working again, and then going back to her normal self. Because yes, like I was saying, some women really, for some unfortunate reason, they get into early menopause, right? They're 30. You shouldn't be expecting that. Under 45, you shouldn't really be expecting to be having these symptoms.
Okay. All right. Esther, was there, any other last comment you want to leave for Dr. Kaniaru before we continue with the show? Esther.
I just think that this education should be something that people should be told. We shouldn't hide things from people. Just tell the young girls that this is what is likely to happen. Then people can deal with it psychologically when it happens. Because most people, nobody tells you about menopause. It's just something that happens. And I don't think, maybe the Africans didn't have a name for it. I don't know. But now we've given it a scientific term, given it symptoms, So, and again, like I said, it's difficult to quantify some of these things because it's different for each person. Some people sweat more than others. Some people don't, sweat less than others. But the sweating thing, you really sweat, at night sweat. So, like I said, you feel hot 1 minute, cold 1 minute. You want a fan all the time. So you might understand why the women want the fans. You understand? It's nobody explains it to you. It's just, you just fall into this information at the time it happens. And I don't know the reason that. So it's good to have this awareness. So
okay.
That's all I can say. I cannot say much because I'm not a medical person. I was just a patient.
Okay.
Yeah.
Asante sana.
I wouldn't want to sound like an expert yet.
All right. Thank you so much, Esther Mulusa, for giving us, talking to us about your experience. Bandio, there's something that Esther brought up, mpaka nimekaa nikafikiria. Kwa lugha ya Kiswahili kuna neno ya menopause.
Na mimi ndio nilikuwa natafuta hapa.
So
it must be lipo litakuwepo.
So and in anybody who's people speak, of course, different languages here. Please type like in the comment section if there's a word for menopause in your respective language, or maybe it's a description, or maybe it's a description of something. Yeah. It's something that
tutarudi next week.
Tutarudi hiyo hapo. Hiyo tutajua hiyo hapo.
Unless there's a way you can go ask grandma, because even our parents
again, here is not about if I know or not. It's like if it's there.
Yeah.
Whether I'm asking grandma or naenda baraza la Kiswahili.
So the issue that Esther was bringing up was like, would it have have been something that people talked about and it was and people went through
it's a word that we would have known.
That way,
I'm not sure about this.
You can describe it. You get what I'm saying?
Okay.
I know, but I knew about menopause, but when doctor was speaking now, it looked like it was something new to me. So maybe they do have it, maybe they talk about it. And I don't even think they involve men back home.
Kabisa.
Correct.
Yeah, that's very
so
true.
This is something, when they go to Jando na Unyago, how much do you know about it?
Kabisa, you don't know what they're talking about.
Over and over again. So I think there is a word for it, actually, in Swahili. But, well, let me take that as a homework.
Okay, so Apa, there were comments coming in as we're having this conversation, on the question of whether you believe food can truly reverse chronic diseases. Edri Bui says yes. Kenyan Jui says yes, we are what we eat. Christabel Michelle Bunde says yes, food is medicine, so people are agreeing. And then I think there was someone who was disagreeing with this. I think this was... Patricia Williams was saying, how, let me see again, what is Patricia saying? How can we reverse type 2 diabetes? I don't think so. So Patricia, like Mini, but we're going to be talking about that shortly. And then Apa Christabel says, nobody ever prepares women for the changes our bodies will go through. I have colleagues at work who are in their 40s now on HRT, and we're going to be talking about that for those who don't know what that is. And then symptoms, Christabel Father says, symptoms vary from hot flashes, anxiety, joint pains, and the list goes on. I've had someone express they have no desire to have sex anymore. Wow. Yeah. This is a big one. And then Christabel Father says, appreciate the awareness and hope we can have more of these discussions. And then we have Anka. Anka says, imagine there are women without X drive. I think she meant a sex drive.
Okay.
Versus someone who has high drive and cannot admit. So, wow, this is let's go back to Dr. Kaniaru, because this is just so much to digest, and maybe react to just some of these comments that are coming in, especially that part of where there's a lack of sex drive. The guy doesn't understand what's going on. Dr. Kaniaru, talk to us.
That's definitely a big issue. Like I was saying,
you are the last.
The hormones dropping. It's not just estrogen and progesterone, but testosterone. Women have testosterone, and that's what gives them confidence, gives them the sex drive. So they are also suffering from this, and that's a big issue, because if the man doesn't understand that, okay, maybe she doesn't want to have sex as much as before, but also the women, right? You gotta, like I said when I started this, you gotta have to keep pushing through it. No matter how you feel. I'm not saying like you be forced into it, right? Because honestly, at that moment, you feel like you don't want to have sex, and then you continue like that. How are you going to get out of it? It's going to be hard. You're done. You're done, and your husband is done, right? So you got to push through that. And one of the things, of course, we really encourage is exercise. Exercise improves our mental health. Of course, we're going to talk about food. That's big in terms of managing our weight, making sure that we're in healthy weight. That really plays a lot into how our body is reacting to all these things. Exercises, increasing blood flow to the area will help moisturize the area, right? Because a lot of women are having dryness and all these issues. And, I was interesting when I was preparing for this, I was shocked that there's some women who get testosterone. So you all know that men get testosterone therapy because they're low in testosterone. And I don't want to go into that, because the reason men are low in testosterone is not because magically something happened. Now they're low in testosterone. They have too much fat. You have too much fat in your body. It turns your testosterone to estrogen.
Wow. Okay.
Oh, so we can leave that. I don't want to go so much into that, but men get testosterone therapy, but I was shocked that some women go to the extent of getting testosterone therapy just to have the sex drive. But all I'm saying is, how about we really need to fix the diet, fix the diet, decrease inflammation, get exercising. We need that body moving and, getting that blood flow going so we can improve the symptoms.
Okay, wow, so much to unpack. But now I think we want to move on to the idea of reversing chronic diseases like diabetes, hypertension, and heart disease, because this is a big one, and this one, I think also the men are leaning in and they're tuning As you saw from earlier, Kenyan Jew is already asking, why is menopause a subject of conversation? But now there's a chronic disease part, the diabetes, hypertension, heart disease, obesity, cholesterol, a high cholesterol. Dr. Kaniaru, you are advocating for a strict plant-based diet. In a recent post you made on Facebook, you said, open quote, you say you are confused about what to eat because you cannot believe humans should not be eating animals as food. It is simple. Eat whole plants. End quote. Now, Dr. Kaniaru, before we get into the details on the benefits of plant-based diets, please tell us what it is that our ancestors, the medical fraternity, and even expert nutritionists have all missed about animal foods. Our audience wants to know why it is that you are one of the few nutritional experts who's advocating for the extreme position that all animal products, from meat to eggs to milk, were never meant to be consumed by humans. Dr. Kaniaru, talk to us about this.
Right. And, just for the records, I've been totally plant-based for 18 years. I had my kids while I was totally plant-based. So, and they told me when I was pregnant, they're like, at least eat some eggs. At least you need to drink some milk. I was like, no, I'm not doing that. And I wasn't born like that. Okay. Because I said 17 years ago, I'm not 17 years. So I was born, in a family where in fact, we had cows. I drank milk. We had chickens. We had eggs. And my dad loved meat. So every chance he had to buy meat, he bought it. So I did all that. But then this is the thing. So I have looked at the studies. So I always had an interest in medicine, and I always had an interest in prevention of medicine. So a little bit background about myself. I'm Seventh-day Adventist. So there was a teaching about plant-based nutrition and health and all this. So I got myself into reading a lot of that, but then I started doing my own research when I came to America. So I went to medical school here. So I came here after high school. I went to, university, and then I started, preparing to go to medical school. So I started doing my own studying. And this is where I found out about the plant-based, nutrition, all the studies that were done about plant-based nutrition and all that. So now it wasn't about church, right? It wasn't about what they told us in the church. And mind you, even though we were taught all these things, not everybody, of course, at church was following this, right? Not even in my own case, right? We were not following this. So first things first, if you go back to Genesis 1:29, and I will quote, the Bible says, behold, I give you herbs with seeds and trees with seed in its fruit. For you it shall be food. Right from the beginning, when God made us, he said, this is the food I'm giving you to eat. Because he knew exactly this is the kind of body I made. This is the kind of human I made. This is what is good for them, right? So he said it. So you don't see right off people eating meat until after the flood, right? There was no vegetation, and then, the animal eating starts. And people talk about like Leviticus chapter 11, which talks about clean and unclean animals and all that. They use that and say, well, why did God say that if he really didn't want humans to eat meat, right? So remember that God was not going to force them, even though he did give the original diet. People started eating animals, and I'm sure like we love it now, they must have loved the meat, right? So he's telling them, well, then at least eat the clean ones. Because, okay, how many people here know that actually eating pig is bad for you? Because pig is dirty. Right?
I do.
Yes. Okay. Awesome. And how many people know that you should not be eating like bottom sea feeders for the same reason they are cleaning up the oceans and all that? So he gave them these specifications about what kind of clean animals to eat and all that. And that continues. And, people argue about Jesus ate fish and all that, the feeding of the people and everything. But remember that still, it doesn't take away the fact that when he created man, this is what he gave us. But this is really what we should pay attention to. After all those years, science has now found out. If you look into science, there's China study. There is an Adventist study. Yes, again, that started from the Adventist, but, scientists were studying the Adventists because they had this, spectrum of eating. There were those that were completely plant-based. There were those that were pescatarian. They were vegetarian. Then there were those, just eating regularly, right? So they just noted patterns. And they realized that those who are completely plant-based had the lowest incidence of diabetes and heart disease and all these other diseases. So they started noticing patterns. The China study was done by T. Colin Campo. He's a biochemist, he's a PhD doctor, who went to China basically and did a study on the food, looked at the culture, the people, what they were eating. And he wrote this huge book about, their lifestyle and the kind of diseases they were getting. So this actually started giving these scientists ideas like what is going on. And if you've heard of blue zones are areas where people live to be 100 years and they are pretty active. They are not dependent on medications and they're doing things, right? And Loma Linda, California is one of them. It's actually Seventh-day Adventist town, really. So, and there's Okinawa, Japan, and there are multiple, there's like 7 of them in the world. And they noticed patterns that these people, besides that they were social and they had, purpose, or they had faith and all these things, they also had a plant predominant diet. Now, this is what I must say. It doesn't mean that they were completely plant-based. It just meant that if you looked at their plate, 80-90% of their plate was plants. Fresh plants. And if they had cheese or they had fish or whatever, it was a little piece. It was 10% or less of their food. So we know that from studies, multiple studies, that if you look, there's another study here. I actually wrote down some lifestyle heart trial, which was done by Dean Ornish. He's a cardiologist here in California. He showed that you can reverse heart disease with a plant-based diet, social connection, exercise, stress management. There's more to lifestyle, yes, but diet is king. Diet is king. So we have all these different studies. There's one other studies that was done to look at the dietary intervention on insulin requirements for type 2 diabetes. So the intervention was a low-fat vegan diet. And what they realized that these people cut their insulin use by 30% in the study, right? So what if they continue doing this? Now, there's a really interesting study I wanted to talk about. It's a plant-based, the title of the study is Plant-Based Diets and Risk of Mortality. It's a meta-analysis, meaning that they're looking at several studies that were looking at the same thing, right? And got all these studies. So it's a big study. And what they found out is that, the intervention was, again, plant-based diet. And it showed lower incidence of disease, lower mortality of the type 2 diabetes, of cancer, and different types of diseases. So there are studies out here. If you go, now people are becoming into AI. If you go to ChatGPT and say plant-based studies and disease reversal, I'm telling you, you will find them. But I just mentioned some for today. And then the same Dr. Dean Ornish did a prostate cancer lifestyle trial. Same thing, plant-based diet, life, low stress and exercising and all that. And he actually seen the prostate cancer getting better for these people that were on these interventions, whereas the control group, meaning those people who just continued in their regular life, the prostate cancer got worse, right? So we have studied, but this is the thing. I want to say why we're missing it. One, if we don't believe the Bible, we don't know what God recommended, then we're going to be fighting. This person that does this study, who is doing the studies? Some of the studies are done by the egg industry, by the meat industry. You think they're going to say that meat is bad for you or eggs are bad for you? So you got to know who is doing the study. So first of all, like I said, understanding what was the original diet and looking at the studies and what actually makes sense. And I tell my patients this. And the people that I interact with, what actually really makes sense? Because today, there's a lot of popularity of low carbohydrate diets that promote animal-based eating, right? As a solution to our disease. And I tell my people, listen, if somebody today told you that eating fruit is bad for you, and eating starchy vegetables like potatoes and squash and all that is bad for you. Eating beans is bad for you because beans is 60% carbohydrates. will you believe this person using common sense? Will you believe this person?
Now, Dr. Kaniaru, wow. Again, so much to unpack here. And you brought the spiritual aspect. And that's an interesting perspective, because here at the OneMic Show, we are diverse in what we believe. And myself, I'm a Muslim, the Quran also talks a lot about food, plants, animals. So I'll tell you this, from a Quranic perspective, they're animals that God has given us to eat. And I'm saying this because there's different perspective from different kinds of faith. So there's a lot of animals that have been mentioned in the Quran. The Quran is actually very, animal heavy, when it comes to teachings about, how to do certain things, how obedient they are to us, how we climb some of them, and how, we eat some of them. There's a lot of verses about that. So this is very personal, because it's not only spiritual, but it's also cultural, in the sense that, most of us come from cultures where eating meat is a normal thing. And I want to slowly first bring this to the panel here, because this is very heavy information that people are consuming.
Can I jump in?
Yes, of course, Mika. I'm coming to you. This is very heavy, coming in the sense that there's certain foods that we are used to eating. Then there's conflicting advice from experts, like yourself. There's another expert who's going to come with a very compelling story about how, we should lower the amount of carbs that we're eating, and that we should increase the amount of animal proteins that we are eating. So we're in a state of confusion.
And eggs.
Yeah.
Mayai ukule eating.
Yes, we're in a state of confusion. And part of the reason why, I wanted to hear your perspective is for the people who are listening to broaden their nexus of information. So Mika, let's hear from you based on what has been said here about diet. Mika.
Okay, so when we come back to diet, this is something that I hold very close to my heart, because if you're somebody who you've known me, you'll know that I've undergone a few changes in the past 3 years in my life. And in those changes, what most people see is just that I've lost weight. What most people don't know is that I've had some health problems. My co-hosts here know and understand. They've been with me through this journey since 2015. And I want to say diet healed me. Medication healed me, treatment healed me, but I want to say diet is the thing that healed me the most. And that is the reason why a healthy living and a healthy lifestyle is something that is so close to my heart, it's so deep to my heart, because it saved my life. So I won't talk too much into it, but I want to talk about the diet part. And one thing about getting on that diet part was me sitting down with doing something called a DEXA scan. A DEXA scan basically looks at your body. It looks at your your percentage between muscle density, bone density, fat, and water, and calculates everything in your body and decides for you how much you need to lose of what part that you have to lose. So I had to work on my bone density. I had to work on my muscle capacity. I had to work on my fat count, and I also had to work on my water count. So basically, I had to reset the whole of my body. And to do that, I had to drill down in my diet into something called macros, not just carbohydrates, not just counting calories as most of us do, but counting the amount, what kind of nutrients you're bringing into your body, how much carbohydrates you have to bring into your body, how much protein you have to bring into your body, how much fat you have to bring into your body. A lot of us, when we were taught on how to eat when we were young, when we were doing science and home science and everything, we were told you're supposed to eat carbohydrates, vitamins, and proteins. Nobody ever mentioned something called fats. Nobody ever mentioned to understand what kind of fats you need in your body so that you can be able to fix your whole metabolism. Metabolism, as we eat and explore different foods, we eat different things that don't work for our body, and our body starts adapting to them. Now, for your body to heal, you need to feed it exactly what it needs, not more, not less. That is why you're always told to keep moving and to eat a certain amount of calories to be able to maintain your weight or to lose your weight. You have to eat beneath a certain amount of calories. And when I was working on my diet my diet was considered that I had to balance it out. I had done all the diets in the world, paleo, carnivore. I had done all those diets. When I realized that I have to eat a balanced diet, I just have to dial down my macronutrients to what my body needs and the amount of calories that my body needs to be able to get back to a healthy place. And that diet was not restricted. The fact of the matter is that, yes, a plant-based diet will give you everything. When you talk about macros, let me define what macros is. Macros are going to be the carbohydrate, protein, and fats. And the funny thing is that all foods have all three macros. It just depends on the percentage of macros those foods have. Now, the thing is, a protein-only diet has protein, a plant-only diet will have proteins, but majority of the time it will have a higher carbohydrate count than an animal-based diet. But when you balanced all these things out, they canceled out each other, or rather they balanced out each other to allow for your body to heal. So when it comes to the diet part, I'm the kind of person who I will tell you, or I believe in that a balanced diet that you incorporate everything is way better than a diet where you're restricting everything. Especially since we're human beings and we have cravings and we like different things. Once you start starving your body because you're and I'm not telling people who do carnivore or who do a plant-based diet that they're doing it wrong. All I'm saying is that I believe a balanced diet is better than cutting out all kind of foods. Because even if we go to the Bible, in the Bible itself, I don't remember the book, but there's a part whereby there's a prophet who was talking and said that God opened the vision and there were two sides, the right side and the left-hand side. And he said the animals on the left-hand side, the dirty animals, do not touch them. The animals on the right-hand side are clean animals, you can eat them. So when we look at the Bible is a book that is diversifiedly wide. And depending on which, and the interpretation of the Bible differs in so many ways. But also in the Bible, animals were offered as food. So for me, I believe in a balanced diet.
Okay, so now this topic on, especially on the spirituality of it, I think we need a full episode to talk about that. Because when we go to the Quran is very, very specific. There's no doubt about what you've been told, what you've been allowed to eat, and what you're not allowed to eat. So there's no interpretation, it's very specific. But then there are questions here, there are questions coming from, like people who are listening regarding your issue of Bible. Christabel is asking, Doc, how will you convince those who don't subscribe to the Bible? And Kenyan Jui is adding and is saying exactly, I'm sure our good doc is not making an unsecular argument for a plant-based diet based on the Bible. There are some of us that don't subscribe to the Bible, so let us stick to evidence-based findings. And then there was also another one that came on YouTube. This is from iContent. iContent says the same Jesus that multiplied fish is who you are saying. He said we eat plants. You gotta know who is doing the study to trust it. But we don't know who wrote the Bible. and you're asking us if we can believe common sense. So hapa, there's a mini crisis.
They are doubting Thomases. I mean, eye contents.
There's a mini crisis, and I can understand. Of course, there are people here who don't subscribe to the Bible. For example, myself, I subscribe to the Quran, but in the Quran, we believe in the Torah and the Injil, but we also believe that changes are made. We don't want to make this a religious discussion, but I think back to Christabel's question, how are you going to convince people who are not subscribed to this school of thought? Dr. Kaniaru.
And that's why I mentioned some studies. I talked about the China study. I talked about, there's actually an EPIC study. So China study was done in China. EPIC study, it was done in Europe, or is actually ongoing. So you check those studies out. EPIC study, EPIC. China study, of course, China. And then I talked about the lifestyle heart trial for coronary heart disease. It was done by Dean Ornish. There is also another study by Dean Ornish. It's a prostate cancer lifestyle trial. So check that one out as well. Effect of dietary intervention on insulin requirements. It's actually a randomized controlled trial. So you can check those as well. So I actually wanted to respond to Michael because he did say that, first of all, very happy that you were able to get your health back. But I want to say something because Michael say that he's subscribing to a balanced diet. But my question is, because you're all rough on me. I mean, I'm just kidding. You're all rough on me. A plant-based diet is actually a balanced diet. And an animal-based diet, and I'm not saying you're following an animal-based diet. An animal-based diet or a diet that is heavy in animals is not going to be balanced. And let me tell you why. Remember, Michael, you say that all foods have the 3 macros, the carbs, the protein, and the fat. Actually, that's not true. Meat, eggs, fish, dairy. Well, no. Except dairy, all animal products don't have carbs. So we cannot say that. But this is the thing though. So you want to eat a food that is balanced, that has carbs, protein, and has fats. And that only applies to, except, like I said, except milk. Milk has carbs. It really applies to plants. Only plants are actually complete in terms of macronutrients. And this is the other thing I want to say about plants, which makes them very powerful. There's 9 nutrients I want you to pay attention to. And today, when you go, please, if you forget anything, don't forget this. Your plants have, number 1, complex carbohydrates is the highest thing you have in the plants. And why is that? Because my body runs on carbohydrates. Please do not run away from carbohydrates because this is your most efficient and most preferred energy source for your body. Not soda, not donuts, not mandazi and chapati, white chapati, no. Sweet potatoes,
ugali,
beans, fruits, ugali, yes. But preferably if you can get like whole grain type stuff, if you can get complex carbohydrates, don't do simple sugars and refined sugar stuff. Once in a while you can do that, but don't make this a habit, So your plant foods are abundant in carbohydrates. In fact, plants are generally about 70% carbohydrates. And do you know why? Whatever runs the engine is what you need most. Perfectly fine. Number 2 macronutrient you have is protein. What does protein do? Protein does repair. It makes hormones, neurotransmitters, it builds muscle and all that. Let me tell you this, you don't build muscle in a day. You don't need to eat a whole pound of steak. Because this is what they made people believe, that you need all this protein to build muscle. No. You build little by little by exercising. You stress your muscle. It repairs, so it builds. So you don't need all that. So your body needs little protein. So your plant food have about 20% protein. They also have about 10% fat, except avocado, nuts, and seeds. They have more fat. You understand what I mean? Like they're going to have more fat. It's not going to be 10%. So your plant foods have all the macros. They also have vitamins, different kinds of vitamins. They have minerals. That's 5. They have fiber. Don't even get me started. I'll talk about fiber for an hour. They have phytonutrients and antioxidants. Let me go back to the phytonutrients. Phyto is a Greek word for plant. It's only plant specific. This is what gives plants their color. It's what gives the purple, the green, the red, the orange. Do you know what this does? They are bioactive compounds that protect your cells and DNA from damage. They're phytonutrients. And then I talked about antioxidants. And you have water. You can imagine your fruits and all these foods, they have water. So today when you go home, think about your plants. But I'm talking about whole plants. I'm not talking about the white flour you go pull from the store. You won't have all that because they processed it and they removed nutrients. Your plants are powerful in nutrients. They are going to come with all these nutrients. And let me say this while we are here. Complete protein. When they talk about animal food has complete protein, guess what? And this is why there's a lot of confusion, because even in nutrition, they told them that for your plants, you need to combine this and that and this and that to get complete protein. Guess what? That has been debunked. Every plant you see out here has complete protein. The only difference is, so a little bit about protein. When people talk about protein, we're talking about amino acids. Amino acids, so there's 20 amino acids, 11 that your body can make and 9 that you need. They're essential, meaning you have to supply from the diet. Guess what? All your plants, each one of them has the 9 amino acids. The only difference is when it comes to your animal food, they have high levels of all the essential amino acids. Your plants have varying proportions. They will have high of this, methionine, and low of leucine and isoleucine and all these different, amino acids. So from that, the nutritionist thought, plant protein must be inferior because you don't have all high levels of amino acids. Guess what? That's what makes plants powerful. Because when your amino acids are not elevated in those high levels like that, it doesn't stimulate growth hormones. There's especially a very powerful growth hormone called insulin-like growth factor. When you eat all this animal food with all these high amino acids, it stimulates insulin-like growth factor, and it stimulates growth. And that's why we have our kids growing, so that they're so young, that they're still 8 years old, getting premature puberty and all kinds of issues, because we are stimulating a lot of growth by eating all these animal amino acids. So in fact, you have better amino acids in your plant. You have complete amino acids in your plant, or whatever, essential amino acids. So I know there's a lot I can talk. I want to pause so then we can continue. Yes. But I wanted to say one more thing. I told you about the 9 things your plants have generally, right? The 9 things. Your animal food, they're lacking fiber, 0 fiber, 0. They're lacking carbohydrates. They're lacking some vitamins like vitamin C. They're lacking phytonutrients and antioxidants. Remember what I said, phytonutrients and antioxidants protect your body from disease. So now you are eating a food that actually will not protect your body from disease. Your phytonutrients and antioxidants are like police in your body that are looking for disease-causing stuff. They're free radicals, killing them. And when you eat an animal-based diet, you are basically letting your body get attacked. You're not putting protection in your body. And I'm not saying we're not doing this. I'm just saying when we think about a balanced diet, your plants are more balanced than anything you can think of. So long as you didn't get it from the supermarket, from the factory that they processed, you got it.
That was my next question.
From the ground. You got it from the ground. If you got it from the ground, it is going to be fine because they haven't removed nutrients from it.
Now, Daktari,
Yes.
Yeah. So I'll tell you one thing, because one thing that all of us have experiencing from when we were born is eating. Like we all have a certain relationship with food. And of course, the information you're giving is very compelling. It's backed by certain studies. But I'm going to read one comment here that Kaniaru made earlier. And he says, so is the issue here the lack of moderation on animal-based food sources as opposed to full elimination of animal sources to a plant-based diet? The root cause of some of these issues that are being attributed to an animal-based diet is primarily how we are raising the animals. At least people, the Maasai, have been on an animal-based diet for millennia and are some of the healthiest people on earth. Now, I know you've said something about the Maasais on your Facebook page because I was trolling your Facebook page, but I'm going to tell you one thing. You've been on a plant-based diet for 18 years. So now I'm going to be the expert of telling you what you would not know, having been in a plant-based diet for 18 years. And I'm going to compare this to, because one thing I compare, there's two things I compare, my expertise is in personal finance. And finance and diet have two things that are very common to each other. And I will also say working out. And in my earlier days, when I would learn about, the most optimal way to do something, and it would be very compelling, and I would wonder oh my goodness, how can people be this foolish? They cannot see this. They have to follow this path. But over time, I worked with a couple of mentors, and they made me understand one thing. Sometimes the best path is not necessarily the optimal path. You who's on a 100% diet, you're on an optimal path. But sometimes the best path is not the optimal path, but it is the path that you can best follow. Because when we go all gung-ho on all animals are bad, I will tell you something, and I don't know how much you've interacted with, especially the Kenyans on your expertise side, which I'm sure you have, is that there are people that you're going to lose immediately. The moment you say all animals are bad, there are people who will not listen to you. For anything that you say after that, it doesn't matter what study you quote, it doesn't matter what it doesn't matter what you say after that. So, and it's the same thing in finance. I came to learn, there's certain habits that people have, over time that may, they may not be life-ending, but they may be detrimental to their financial well-being. So you're better off guiding this person towards doing this less in a consistent way. Because when you go cold turkey, what happens? When you go cold turkey and decide, this plant-based diet is so compelling. You know how long you're going to last? 3 days. You will last 3 days, and even if you make it to the 4th day, you're going to be very lucky. That's why I think it is very, very important to ensure that, even in your evangelism of the plant-based diet, to be a bit kind. I'm in the same school of thought as maybe Kaniaru, because I think part of the problem is that there's an excess of these foods that are being eaten. That there's no doubt, and I think we can all agree that eating excess red meat, if breakfast, lunch, dinner, ni 80% of your plate ni nyama, we can all agree that that's a serious problem. But if we have a situation where you're mixing up the foods you're eating, unakula ugali. And here, not saying that this is the optimal path, but it is the path that people can take. Because I'll tell you, ukija pwani, ukija kwetu pwani, and you bring all that talk of plant-based diet, goodbye, good night, that's what you're gonna get. Ukienda kwa kina Omosh, watu ambao wamekuwa kila samaki tangu kabla wazaliwe, hata kabla nyonye maziwa tayari wanakula samaki, and then uambie samaki si wazuri, goodbye, see you some other time. So I think that is the challenge, daktari, that you're gonna have to deal with, because I think the goal here is to get people towards a healthier diet. and not an optimal one. Because your optimal one, I will tell you that from experience that it may not work. And I think also Bandio had a couple of questions, like when you were talking, and mi yangu ilikuwa tu ni, like bringing the human side of it, not the expert side, but the human side. Bandio, you had a couple of questions you wanted to ask her.
Moja tu. I just wanted to see, when you talk about all these, did you call them nutrients? Nine what you say?
9 nutrients.
9 nutrients?
Yeah.
Does it matter how that plant was farmed? My question is, if I'm eating organic chicken or organic cow compared to manufactured plants, because nowadays it's like some of them are really manufactured. They don't see sun, and it's just chemical from, kupanda mpaka kuvuna. Do we still get 9 nutrients when the vegetable or the plant is like that? And 2, what's your take on these plant-based, how do they call them, beyond meat kind of product?
Right. Very, very good question. So I will actually give my own example, because I bought regular grapes and I bought organic grapes. I can tell, because I find like a regular grape that they have done whatever they have done to it, and it's like watery and it's big and all that. But even with that, personally, I do try to do organic, but I really don't all the time, because even outside, I have a little backyard. I try to plant some, skuma there and stuff, but it's hard. It's actually not easy.
Yeah.
So what ends up happening, I try to get organic if I can't, and actually sometimes I get frozen. I go get like frozen blueberries organic, frozen whatever, mango chunks and all this, whatever I can get. But honestly, for me, I shop even at Walmart. I get what I can get. Because to me, honestly, it is still better. You might think that, well, it might be better off me going to get the farm-raised chicken or organic, beef, steak and all that. Because listen, this is the thing. Flesh is flesh. That chicken, that meat is coming with no fiber. That you cannot do anything about it. It's coming with cholesterol. It's coming with saturated fats. That's the solid fats. But also when we cook this, and we love nyama choma. I'm sorry, my Kenyan people. We love nyama choma. Do you know what happens when you sear that meat and you make it burn and you turn it black? You create carcinogens. Do you know what carcinogens are? They're compounds known to cause cancer, and especially red meat. You burn red meat like that, you're creating carcinogens. So meat is not going to change, even if, yes, there are some differences maybe in your fat content and maybe stuff because it's organic versus non-organic, but flesh is still going to be flesh. When you burn it, flesh is going to act the same. It's going to create carcinogens. It's going to create inflammatory compounds, all these issues. It's going to give you cholesterol. So what I say, and I really understand what you're saying about moderation. You can't, talking about personal finance, because my husband does the same thing, and we always, I'm always looking into that. So I understand completely what you're saying, because he goes, yes, we should be doing this, but yeah, we're not doing it, or we're not doing it fully. You understand what I mean? Like, it's all a spectrum. So what I recommend to my people is, if you're sick and you desperately need to get well, and I'm sure many people will, because let me tell you something, and I know we are not here to talk about that. Do you know one of the earliest signs of heart diseases for men? And I know we're not here talking about men. Well, we're talking about everybody. Erectile dysfunction. You eat this meat and all these cholesterol and saturated fats, it clogs your little arteries that go to your penis area. And you can't sustain an erection. It's the early sign of coronary artery disease. Like, you having basically disease all over your body. And that's the first place it manifests, because those arteries are so small. And you need blood flow. You need good blood flow to go to your penis to have an erection, to sustain an erection. So I tell people, why would you play around with this? You come to the doctor and say, I'm having erectile dysfunction. And they're like, oh, there are some other things they look at. Are you having some psychological issues, whatever, testosterone issues? And remember what I said? Testosterone issues, it didn't just appear. You converting your testosterone into estrogen. We're making this happen in our body by having so much fat in our body. And while I am on that, why do we accumulate too much fat in the body? It's not because of carbs, like they are telling us out here, like, oh, carbs get turned into fat. What did I say? Carbs burn for energy. You eat fat in the nyama choma, you eat fat in these eggs, in these dairy products and stuff. That's where the fat comes.
So what happens to excess carbs? Because now this right here is part of why people are in a state of total confusion. Exactly. Because there's another expert who's gonna sit there like you and tell us, like using studies and scientific evidence that excess carbs are what is converted into fat. So, and me, I'm speaking for most people are in a state of confusion.
Me, I'm confused. Yeah. Atkins, pia nilisikia ni poa.
Yes. So I think this is where I think all nutrition experts need to have a kamkunji. I think you all need to be locked up somewhere.
And then you decide.
And then you go, you're locked up.
You decide.
Whoever
comes out.
Like a conclave. You guys need to have a conclave.
Yes.
Yeah. Like whatever decision comes out of there is one. You guys can fight in there. You guys can do whatever you want. Because
mimi nanimaliza na coffee.
Yeah.
Unaambiwa hii ni nzuri afu nakwambia ni
kwanza coffee sijui inakuongezea sodium, sijui it's got potassium, and then body wewe.
So you see, and then Esther Mulusa here also made quite an interesting comment.
Now, before you go, I had a question.
And then YouTube,
Doctor, what about how we prepare/consume? Because I think the Maasais of 70s walikuwa healthier kuliko Maasai wa sasa, even if they're still, consuming the same type of food and everything.
Mm-hmm.
And I wonder if how we, not only we raise them, but how we prepare hicho chakula sasa hivi na microwaves na air fryer and all this stuff, hii pia ina play part kiasi gani? Not only
I was looking into that because people tell me that a lot. They say, but look at the Maasais, and I say, please don't use Maasais because you don't live a Maasai lifestyle. You don't. I don't.
But then
they're nomads. Can you actually get that much activity in a day? And I asked them. The Maasais, the livestock is their livelihood. Yes. Do you really think they're slaughtering these animals like we think they are doing this? Are they eating that much meat like we think they eat? Now, if you compare milk, I know for sure they drink a lot of milk.
Yes.
But when it comes to meat, I don't think, and I was reading too about this. But now lifestyle has changed for them too. They're eating processed foods, they're eating chips, all these fried foods. Because remember, as I was starting to talk about fat being stored in the body as fat. So if you're also eating all this fried food, you cook all this food and you cook chapati and all this food. So fat also, in terms of calories, fat oils are the most calorie-dense foods on the planet, right? Just a gram of fat is 9 calories compared to a gram of carbohydrates, which is 4 calories. And I ask my people a lot, which one do you think will make you fat? A carbohydrate that has only 4 calories or a fat that has 9 calories? It's more than double the calories you have in carbohydrates. And remember, if your body is programmed to use carbohydrates for energy. So when you eat food, let's say, for example, you eat rice and meat, your body will digest that food. It uses the carbohydrates for energy because that's the easiest thing to do. The body will do the easiest thing. It burns that for energy. So all the fat that came with the meat you ate, where did it go? If you didn't do any extra thing to actually use it, it got stored because your body preferentially uses carbohydrates for energy, and there's nothing we can do to change that.
Okay, Mika had something that he wanted to ask before we lose that point. Mika?
Yes.
No, as in, for me, it's just that these are the things. And as I was saying, your body is treated when you eat a balanced diet. Simple as that. When you eat excessive of everything, if you eat excessive of carbohydrates, it's going to be turned into glycogen. And if you, which is going to be stored in the, it's going to be stored in the liver and muscles. And then if your body has more than that, and then if you go above that, it's converted to fat. Anything that the body consumes that is in excess will be converted to fat as storage. Fat is what the body will try to burn down when it doesn't have anything to give it, to give it energy. So that is why if you are so used to eating and your body knows that the way I fuel myself is through eating, you'll be always craving food because your body is always going to communicate to you to feed it. But then if you communicate to your body to use its fat reserves, and that is why you're being told to eat below a certain calorie, to eat on a caloric deficit, you're being told to be active so that you can burn calories. You're being told to grow, like go to the gym, lift weights, grow muscles so that your muscles can burn, which need to be fed, will be using the food that you're eating to grow itself. And so your body doesn't store anything that you're eating, it's consuming it. It's just a matter of balancing yourself out. So the thing is that everything that we bring into our body in excess is going to be stored at some point into fat, because the fat is what the body is going to use itself to give itself energy. And as you stated earlier, doctor, the body will always communicate to itself on feeding and reproducing itself, which consumes energy. So the main engineering complex of our body is in terms of it has to energize itself to keep living, which is regrowing itself. As it depletes itself, it regrows itself. So
yes,
when we are talking about this, and as Ali was saying, when we pull to one side, we are losing a lot of benefit. How can I say, important information, because I never said plants are bad. Plants are actually good. They have a lot of, as you said, complex carbohydrates. Like somebody who wants to lose weight, if you eat potatoes are high in protein and high in carbs. They are very high in carbs, but also high in protein for plants. Most people don't know that. So depending on how you consume that potato, if you're doing, let's say, air-fried potatoes or baked potatoes, you can eat a lot of potatoes without gaining a lot of calories, and they're healthy for you. So most people don't know that there's some plant foods which are actually good for you. We just dismiss them because of how we prepare them. We prepare them badly. Ukifry ikwe chipo, calories zitatoka kwa mafuta, si kwa waru, but tutablame waru.
Wow. Okay. So now, let me go through some comments here, because we've also been having so many comments as we've been having this very compelling conversation with Daktari here. Let me start from here. Kenyanjui said, Doc, I don't think anyone is bashing your push for a disproportionately larger plant-based diet compared to animal sources. The concern is that you're framing it as a binary choice, one or the other, all or nothing. The real issue is deviation from moderation, like eating too much animal protein. And then we have Contrum Kenya, and Asema, due to recent developments at the CDC, it's hard to question cherry-picked and biased evidence-based studies geared towards meeting individualized or group-based objectives. My brothers from Western Kenya can also come up with many studies to support an Ingoho chicken-based diet, and no one can dispute it comes down to it. And then Esther Mulusa says, I'm rather skeptical of Western scientific research. They debunk and change their stance every now and then. One day milk is good, the next day milk is bad. And all of this change of stance comes from even Ivy League schools, which is very true. This is notoriously true about Western sources. And that's the reason why I think it's important to try to balance this with other either non-Western or non-traditional sources. And then Christabel here says, I agree with you, Daktari, that plants are powerful nutrient sources. I would only argue that everybody's body composition is different, so it's really not a one-size-fits-all. Generally, we need to incorporate more plants in our diet and less animal products. The quality of animal products is not that great. They are fed grains and antibiotics. That's why you need to go buy halal beef. But anyway, that's a story for another day. And then Steph.
Ali. Is it halal because of the way it was raised, or halal because of the way it was slaughtered?
So halal farms, there's a standard that they have here in the US. So there's a standard that they have in the US.
So when you go to halal store, are you buying halal? Is that a meat from halal farms?
It's from halal farms.
It's a halal source and everything.
It's halal farms, and they're not allowed to feed them iso antibiotics. They're not allowed to feed them those. They have to feed them natural stuff. Yeah.
Sisi wakati tunakuja kuchinja tunaambia muite Ali akichinja hapa itakuwa halal hata kama mmemkuza na kemikali.
There's that one. Yes, but not the one you're buying.
That was true back home. Unajua, by the way, Kenya hakuna label ya halal because all meat is halal. All meat is halal. Nyama unanunua kutoka butchery Kenya yote 100%. In Kenya you'll never see halal label.
Is halal because of the way it was slaughtered?
So hapa
not the way they were
back home
raised and fed.
Back home animals
inafaa kuwa the way it's raised, si slaughter pekee.
So you see back home hakuna issue ya kufeed antibiotics. Kama imeanza now unless imeanza recently. But ukienda Umasaini ama ukienda kule ambapo wanakuza like ng'ombe na mbuzi, it used to be in open.
Mimi nilikuwa nafanya biashara ya nyama in 1991, 92, 93. Niko primer.
Yeah.
Okay. Na kipindicho depends on where you are. Yes, I agree. Yeah. Baadhi ya sehemu, lakini kuna sehemu ambazo ilikuwa una
inject. Okay, sawa. Hiyo topic tutaongea another day.
Yeah, that's topic. Na kama unajua, at one point East Africa ilikuwa inaonekana ARVs zilikuwa zinatumika zaidi kulisha wanyama kuliko wagonjwa.
Okay, that's a topic that we're going to talk about another day. Kenyan Julia says,
you've even scared the doctor. She's even about to withdraw. Where?
Hapa Kenyan Julia anasema again, why is she making this a binary choice? That's where she's losing me. As Ali put it very well, but even if the good doc wants to reference the Bible, she cannot choose to ignore that part of the Bible that gives humans explicit permission to eat meat of animals, for the first time supplementing the diet of plants. Every moving thing that lives shall be good for you, as I gave you the green plants, I give you everything. That's Genesis 9:3. And then we have Mutslis Ndunge anasema it's both. Excess carbs are not good, just like excess protein. At the end of the day, it's calorie in excess. And then hapa Kenyanjio anasema bottom line, if the doc is strictly comparing plants versus animals, sure, plant diets look healthier, but we eat for more than calories. Animal foods carry emotional and cultural value too. She's throwing the baby out with the bath water. So very strong opinions here. Hapa YouTube, let me take a quick look. Nisi neglect what
answer na Africana voice for elephants.
Africana voice. Let me see. Let me see. Let me go back to Africana voice. Voice.
Iko juu ya
I think yungu. Yeah.
No,
so
answer hapo alafu you have to.
Okay, sawa. So Africana voice says elephants, horses don't eat nyama. Okay, and then and then hapa Vicky anasema watching from the land of 1000 lakes. I content anasema it's giving pyramid schemes in quotes. Unaona hapa because it's a very personal relationship that people have.
I think I content and what's the other guy huyu mwingine?
Mwingine sasa I don't know
on FB.
Yeah, Kenyanjui.
They are the same person. But
okay. And then hapa resilient Vicky Onderi kwanza anasema asante, this is fire. Resilient says I don't think we need to remove meat in our diet. Get 100% grass-fed, 100% grass-finished. Get lean meat. For fish, avoid farm-raised fish. Get the wild-caught. Get organic pasture-raised eggs. Then Resilient also further says, of course, get a lot of vegetables in your diet. Get organic vegetables, easily sourced in farmers' markets. And then content anasema mi nilitoa daktari TikTok. I don't know what he means.
Alisema mulitoa.
Mlitoa daktari TikTok. Okay.
Sindio.
Wow.
Yani,
okay.
Yani
resilient.
Eye content. I'm telling you, this eye content is the same Kenyanjui.
Resilient says, I've had Masais don't eat a lot of milk as people want to suggest. I think the resilient meant meat. And then don't eat a lot of meat.
Yes.
Okay.
Yes.
And then Apa Misha is asking, is chewing miraa vegetable healthy? Okay, all right. That's
anataka daktari to answer. So daktari should answer that now.
Na swali la kizushi hapa.
Yeah.
Kama wanyama, kama ng'ombe anakula majani. Ndio?
Yeah.
Ng'ombe hali nyama.
Yeah.
Mbuzi hali nyama.
So unasema vegetables zako ziko ndani ile nyama.
Hapana. Ila ninachosema ni kwamba then kwa nini sisi tusiachane na nyama kama middleman tukaenda moja kwa moja tukala majani?
Tukala majani. Okay. Sasa.
That's the plant based that you are being told.
Yeah.
Or the grass.
I'm just saying kama ng'ombe anakula majani tu.
Yeah.
Na sisi tunamla ng'ombe. This means ng'ombe ndio middle.
Ndio middleman, yes.
Yeah. Tuachane na middle.
So we can just eat that.
Anachokula ng'ombe.
It's easier to eat that vegetable when it's inside the cow. So you eat the cow has vegetables in it. But Apa Resilient anasema for me I need Resilient anasema for me I need meat, but I know the kind of meat to buy. 100% grass fed, 100 grass finished. The issue is eating meat from cows that have been fed grains. And then let me see Apa Misha utapata jibu yako from doctor you about miraa. We're gonna give a chance to answer that. Resilient anasema you can buy directly places like US Wellness Meat. And then Afrikana anasema umewai sikia ndovu akisema leo nataka nyama. And then Resilient anasema to the panelists, the meat needs to be 100% grass fed. 100% grass fed. The animals have not been fed on grains. Yeah. So
kuna documentary moja inaitwa nitatafuta jina na tuliangalia kwenye darasa la Culture of Capitalism. And I remember tulipoangalia ile watu wawili ambao walikuwa wanafanya kazi fast food waliquit that day, wakionyesha how animals are fed here in the US. Na inazungumzia wale ambao sio halal, ambao ng'ombe tangu anazaliwa mpaka anakufa hajala majani, anakula mahindi tu na chemicals and all this stuff na wana scoop. So taitafuta.
Okay, let's go back to daktari. You know, like there's maybe anza na hiyo miraa, and then so many other things. And this is the, let me say, the danger that you're gonna get into daktari, because I think the goal is not to lose people. And I think if it's a life and death situation, especially when we're looking to reverse certain conditions we have, we're talking diabetes, hypertension, I think it's important for people to seriously consider this, because that's now an emergency situation. But let me let you talk, Daktari. Tuanze na miraa, and then we're going to go to the other things that people were talking about. Daktari.
Of course, you know, I'm going to say no drugs. That's not going to help. There are like those things we use for herbal tea that have antioxidants and phytochemicals, right? What are those that you buy? You understand what I mean? Like those herbal tea stuff that you buy and put in your water, right? Hot water, but no, not miraa, because this stuff have some psychoactive stuff that can really affect your mental health, your brain. So you don't want to be doing any of that stuff, even though it might be legal, right? You don't want to be doing that. And while we are on that, let me talk about alcohol. One of the things that we got to address when it comes to diseases and even, weight gain and all this, if you're drinking alcohol, it's going to be really hard to maintain healthy weight, to lose weight, because guess what? Like I said, your preferred energy source for your body is carbohydrates. When you drink alcohol, before even you can use your carbohydrates, you have to use the alcohol. So this is why people that drink alcohol gain weight, because now imagine you have You have to use alcohol first, then use carbohydrates, then start using fats, right? So that becomes a real issue. Of course, smoking damages health in all ways. So we don't really want to go into those things. So there are multiple things that have been said, listening to the questions, the comments. And one thing I wanted to say, by all means, this is not all or none. I'm trying to defend, showing, all I'm trying to say, to show you is that you have superior nutrients in your plants. Just know that. So that if you're going to eat any animal products, you make it minimal. You make it minimal and the best you can. Like you said, grass-fed or free range and all this. But I'm asking also another thing. The reason why probably they're feeding these cows with grains is to catch up with demand. Where are they gonna get? Where are they gonna have free range, cows? Because of the demand. Just imagine the number of people go to the store with the promotion of this high protein diet. And remember, you cannot separate these two. A high protein diet is also a high fat diet, because really high protein means animal protein, right? Because if you think plant protein actually has more carbohydrates in it. So this is the issue, that it's not only about our health. Let's think about what's going on with our health. Did you know that one of the leading causes of climate change is animal agriculture? Do you know how much resources we use to produce these animals? To produce plant food to eat versus animal food to eat, let's say even just cows, the meat and stuff, it spends more than 10 times the resources. And these cows produce methane, which is a greenhouse gas. So we are changing our environment. We talk about how we're going to decrease, global warming. We have to decrease our animal consumption so we can stop all this animal, breeding for food. Because if people ate meat naturally, like a cow that can be grown for who knows how many months, 18 months, but they can grow it for 6 months. They can grow a chicken for 21 days instead of taking, I think I said it backwards. Your cows probably take years, right? But your chicken, instead of growing it for 18 months, they're growing it for 21 days, right? Your cow, who knows how many years it takes, but they can grow that in months, right? So if we can slow down on our consumption, eat just the natural stuff. So that means, you know what that means? If you're going to eat that meat naturally, you're not going to eat it so many times. It costs more. It's expensive. So you're not going to eat it as much. There will be control in it by itself. And the way you cook it, like we said, if you're going to do nyama choma, you're going to produce cancer forming compounds. They're called carcinogens. So they talk about baking it or boiling it or making stews instead of nyama choma. And people love nyama choma. That's what they love. So that's an issue, the way we cook it too. So I'm saying it's not all or none, but there are studies that have shown that even consuming 2 eggs a week increases your risk of diabetes. So if we look at our environment, yes.
Yes. So we actually have a caller. We actually have a caller. We're going to get back to that.
Na kuna mtu alikuwa anazungumzia 5 eggs a day.
Nilirarua 6 asubuhi. Sasa naambiwa I'm done.
Yes.
Remember, I'm saying 2 a week. I'm not even saying 2
a day. Na tulikuwa tunapiga 5 a day.
Yeah, so we're going to get back to that again. I want to remind the listeners that you're tuned into the OneMic Show. Number to call is 202-683-4570. Press *5 to speak, and we do have a caller.
Piga mayai matano na nyama choma. Anyway, let's go to
you are a carcinogen type of guy.
6414. Welcome to the OneMic Show. Tell us who you are and where you're coming from.
Tell us who you are and where you're calling from.
Oh, hi. This is Kathy, and I'm actually calling from the Bay Area in California.
So is it Kathy?
Kathy.
And yeah, Kathy, that's me.
All right, Kathy, talk to us. Talk to us from the Bay Area.
Yeah, so my question actually is about, and I don't know if you guys discussed this earlier on and I missed it. So I understand, between the plants and the meat, and I think someone addressed the grain in the meat and all the bad stuff that's in it. But I think we cannot fail to have this conversation and not address the fact that we live in a society or in a country that, almost all its produce and meat and dairies and all that stuff has a lot of chemicals in it, has a lot of things that are not right for human consumption. And, in conventional supermarkets, that's all that you get. But then organic food that's wholesome without any of that stuff is very, very, very expensive for the regular American person, and not a lot of access to it. And so how do you actually address that? If you're telling me to eat a lot of vegetables that are good for me, talking about gaining weight, but then all the vegetables and all the nice produce that I know, it's not grown well. It has a lot of stuff in it that might not even help me at all. So how do you address the high cost of organic food in America, the chemicals in the food, and how to maintain good, healthy, fit body?
All right. Dr. Kaniaru, address Kathy.
Right. So, and that's actually before Kathy, probably before she came on, I was talking about how I sometimes get food from Walmart, right? So it's like, honestly, if you think about it, having, just regular meat, not organic, and having regular vegetables or fruit, which actually is better if you think about it, right? So looking at that, and I'm saying people have improved their health eating organic, meat and chicken and eggs and all this because I think how expensive these foods are, it probably regulates how much they're eating compared to if you're just eating regular, right? So these people's health is going to improve because already they are going to eat much, much less than regular, people. So what I'm saying is, we can try to grow some of the food. You can grow all the food. You can try to grow what you can grow, get organic what you can get. And there are those dirty that they call, the I think it's the 30 dozen or whatever. Like there are those specific ones like strawberries. You want to try to get organic. The one with thin skin that get all pesticides and whatever stuff. So there are foods that I try to get organic, and some I just don't, because again, sometimes you don't even find it, or you find it and it's like not even looking good. It's been sitting in the store who knows for how long. So some I get frozen, right? I get like frozen organic strawberries, frozen organic blueberries or mangoes, and whatever I can get frozen, I go to the fresh. So some, it's not fast. Sometimes I know specific stores to go. I know what to get from Costco. I know what to get from Walmart and grocery outlet. Like I will go to different stores to just get what I need to get. And sometimes, like, I live in the Central Valley area, Fresno, California. So there's a lot of farming here. So like right now we have like peaches, plums, we have of course watermelon and stuff. So I will go to the people that sell it on the stalls, right, or by the roadside, or go to their home, and I get way more. I get a whole box of, or it's during the orange season which passed, I'll get a whole box of oranges for $20, and we go and eat for 2 weeks. So, I mean, it's really paying attention. I tell my people that you have to stop spending the least time with the food you eat. The least time, I don't even want to think about, where I'm going to shop. I want to get the fastest thing. I just don't. I don't. If you do that, then it's going to be a problem. You're not going to get as healthy food as you want, or maybe you go get fast foods and all this thing. We have to make, because food, like I said, is top when it comes to health. And many other things. Maybe we'll have time to talk about other lifestyle things, but we have to really spend that time, prepare the food, and it becomes easier. I can tell you when I started, because, now I have kids, I can't just feed them ugali and boga. No, they're like, no, So I had to learn how to make them plant-based pasta, plant-based macaroni and cheese. I make them pancake from scratch. I make them muffins. I make them pizza. Like I had to learn.
How do you make pancake without eggs? Without?
Yeah, actually, I do. And if you go on my I have some YouTube. I just need to do more. I keep telling myself, because seriously, it really does take time. Lifestyle Medicine Global on YouTube. But if you go on my Facebook, I share. Whenever I share food, I share the recipe too. So Daphine Kaniaru on Facebook. If you're on Facebook, you'll find me and see the recipes I post. So I have learned, and I look at recipes online. Now I go to ChatGPT and I'm like, change this recipe for me, make it on only plant-based, no oil. Oh, that's another thing. By the way, I don't even use oil to cook my food.
Yeah.
My husband loves chapati. Okay, listen. My husband loves chapati. He cooks them maybe once a week, and I don't even eat them. Because for me, once I started cooking my food without oil, I can't. I just can't have food with oil. I was visiting Kenya 2 months ago. I ate food with oil because, I mean, come on. What was I supposed to do?
You could have carried your non-fat oil. Sorry. I mean,
Still.
In my house, I don't use oil because if you listen to a lot of people, a lot of health experts also talking about seed oils, refined oils, and all these different oils, and saying, well, maybe avocado oil is better for cooking, and what about extra virgin oil? But remember, in terms of cooking, yes, avocado oil is more stable in terms of the temperature, but still a tablespoon of oil is 120 calories. 120 calories, mostly empty.
So if I'm not,
Utakufa vibaya.
I'm using olive oil. I've got the virgin one from Italy, and it came with I don't know, a plane, and then you're telling me I can't cook my eggs and I can't eat 8 of them because if I eat 2 of them, I'm going straight to the heart doctor.
I'm still surprised that kwa nini niko high. I think
so based upon what she's saying, I should be dead. I mean, I had 6 eggs this morning.
So there's one other way in which you know, like
Kathy bado yuko, I'm not sure kama so lucky.
Yes, so Kathy sijui kama bado yuko was
yupo.
Yeah, Kathy, we're gonna give you another.
And I had a follow-up question though.
Yeah, go ahead,
if
Kathy.
you can let me.
Yes.
Yeah, so I was just gonna say, and I do respect Dr. Kaniaru a lot, and I'm just hoping and that, you know, her story and her where she's coming from with all that knowledge that she has and all the research that she has, that it doesn't come across as if she's trying to instill her own lifestyle into the lives of other people. And I'm hoping that this message is gotten, because I don't want to get out of this phone call feeling like, oh, she was only trying to instill or push down my throat how she lived her life. You know, I want to come out of this knowing that I have so much information about bad oil versus avocado oil. You know, I have so much information about plants versus meat, you know, what I need to do. So I'm hoping that that message goes across well, as should be received, versus feeling like, oh, she was just telling me what to do.
Well, yeah. Dr. Kaniaru.
You know, one thing, like I was saying, what I'm trying to say to have my people understand is this, that when you're eating food, you want to make sure you get the most out of it. And I want you to be clear today that you get most out of natural plants. That is a fact. It's not something that I'm making up, because like I said, your plants have the 9 nutrients I talked about. So with that in mind, when you're going to make your food, make your plants the center. If you do that, you way ahead. If you make your plants the main deal, the main issue, then everything else is on the side, right? If you're going to eat your little meat, it's on the side.
Your 2 eggs.
No, she said 2 eggs a week, you're done. So you can't.
But what I'm worried about,
even boiled eggs.
She said the eggs.
Right.
Doesn't matter.
Boil 2 eggs on Sunday.
The egg is the egg.
Chop in pieces. The spread all week.
That's the egg is like,
if you gotta have it every
the
every
egg
day.
is like flesh. Flesh is flesh. Egg is egg.
Yes, and that actually, let me say something about that, because you know I usually get a lot of people, you know, fighting me on the internet. So you know, I'm used to it by now. So this is what I tell people. Milk is not for humans. Milk is for baby cow. And if you look at the nutrients, the top nutrients, milk is
watu wawita mixo wameepa
Rasclat.
hata ile milk imekamuliwa kwa almond, hata sije kwa almond.
Your almond ni different, so I'm coming to that. So but I'm talking about cow milk. So cow milk, the top nutrients in cow milk is lactose and fat. So milk, you see how the baby cow, the calf grows so fast because of the nutrients in that. It's not the same as the human milk. So I tell people, yes, human milk is perfectly fine for your baby. Milk is for infants. But when as adults, as grown, after we're out of infancy, we don't need milk. Now, you might ask, what happens to calcium? What happened to vitamin D and those things? So did you know that the vitamin D in milk is added in the factory? So it's not natural in the cow milk. Number 2, calcium. The cow gets calcium from the grass. So you can get calcium from the greens. You eat a lot of greens, you not only get calcium, you get iron. In fact, I'll tell you that, of course, I can't give myself, I'm one case study. I can't give just myself as an example, but I've never been anemic. I've been plant-based for 18 years. I've never been anemic. So this thing of, you become anemic and all these things, in fact, the iron you get from your animal, from your meat is not controlled. It's very bioavailable that you absorb so much, it can actually become toxic to your organs, your liver being one of them. So you need some control. And when you eat plants that have the iron, calcium and all that, it controls how you absorb these nutrients. So I want you, my sister, my goodness, remind me your name.
Kathy.
I want Kathy. Please, when you live here today, I want you to know that all I'm trying to encourage is let the plants be the center and the whole plants. And one of our panelists did ask about processed meat. In my house, processed plant foods. In my house, you will not find impossible.
Beyond meat.
Not find beyond meat in my house. The only things you find in my house is whole wheat, you find brown rice, you find oats, you find quinoa, you find millet, you find beans, lentils, garbanzo beans, you find all different kinds of vegetables and fruit. Tofu is as much processed I go to, and soy milk. Otherwise, I don't do processed food as much as I can.
How do you get soy milk without being processed, though?
Yeah, soy milk is processed.
That's what I said. It is that's as processed as I said. Tofu and soy milk is the processed thing. I actually make my own soy milk, but it consumes time, so sometimes I have to buy an almond milk. So those are the things you find in my house. My kids
So I think the part where you said, like humans are never meant to consume milk beyond infancy. I think that's something that we can agree. You're gonna have problems with that statement, and I'm not saying it, as an expert, but we can agree you're gonna have problems with that statement. All the maziwa nyayo we drank, I think now maybe
we should be dead now.
Yeah,
we should be dead now.
Maybe has gone to waste. But I think these are those things that, like I said, because there's a lot of confusion. All major nutritional experts should be locked up in a conclave. And go duke it out and agree, because even when you look at advice from the CDC and also the FDA, the Food and Drug Administration, when you look at their history, they've been changing. There were points where they were saying good. Then one day they changed their mind. Bad. Good. Yeah. So it's one of those things that I think people will still be in confusion, but I think people who will be the biggest beneficiaries are especially people who are looking to reverse, certain conditions, the diabetes, the hypertension, because reality is that these are conditions that are really affecting people in the community.
Especially blacks.
Yes, and there's evidence that plant-based diets may be beneficial in trying to reverse those. Now, one other thing that I will say that I can speak from personal experience, and maybe you can talk a bit about it, is fasting. Because I've not seen you talk about fasting so much.
Intermittent ama gani?
So unaona sasa kama sisi Waislamu we have the dry fast.
You are the last party.
We have the 30 days in a year dry fast, which generally speaking, I usually lose between 10 to 15 pounds.
I think it was about on Wednesdays, right?
Yeah.
For SDAs.
So SDS in the SDS sijui, but your Islam it's a solid dry fast. Depending on the time of the year, it could be up to 16 hours. It could be anywhere between 12 to 16 hours, depending on what time of the year. Then we also optionally fast which I also practice on Mondays and Thursdays.
Okay,
it's Mondays and Thursdays twice a week, which I do. Which of course it eliminates everything that you're gonna eat. So basically, you're choosing 2 days a week, and you're eating 1 meal a day. I typically do not eat more than 2 meals a day, but on this particular day, you're eating only 1 meal a day. So please talk to us about fasting and what benefit it could be, especially for the majority who are not gonna comply with the idea of no milk, no eggs, no meat,
no cornflakes, no.
Ali.
Yes, Mika.
Hiyo kitu Waislamu hufanya ni intermittent fasting. You just change the times of the day that you're eating.
So why I would not call it intermittent fasting?
No. Scientifically,
no, even scientifically, because scientifically,
Kenya ulisema it's a dry fast.
Yeah, it's a dry fast. Yes, which is very different. Which is if you do 16 hours dry fast, it's a very different fast from when you're fasting 16 hours na unakunywa maji na unakunywa kahawa.
But intermittent fasting inamaanisha tu kugeuza timing ya kukula. Basically, intermittent fasting unakuanga na time frame. Unakula between most times usually between saa 8 na 8 p.m. Yeah. And it's actually very good. That hiyo ndio nilitumia kufanya niweze ku reduce my calorie intake. It was so that you have a small window of eating. Unajua kikanjaa for long, alafu kule uweze kula sana.
Uweze kula sana.
Yeah.
Okay.
So by the time unakula between your window, unazoea kukula, like it helps a lot. So it's usually just reverse time ya kukula. Like you give yourself a window of eating.
Okay, let's hear from Daktari about fasting.
Actually, that is really interesting, Ali. I didn't know that you do dry fast, meaning no even water, no liquid.
No.
From dawn to...
For 30 days.
For 30 days.
And you know when we start...
From sunrise to sunset.
Yeah, and you know when we start, we start being taught how to fast at age 7. By the time you're 10, 11, you're fasting a full day. And I'll tell you, no one has ever died from fasting. There are people who are exempted, breastfeeding mothers, if you're pregnant, if you're sick, if you're traveling, there's certain exceptions. But trust me,
you are healthy,
yeah, you'll be okay. No one has ever died because of fasting.
Right. And you know, you're right, because definitely because you have decreased so much the amount of you're eating only once a day, you have decreased your calories so much, you're going to lose weight, definitely. But let me talk about, medically, when people talk about intermittent fasting and people talking about 1 meal a day, OMAD, right? So they're doing 1 meal a day, or other ways that people, or the eating window 6 hours and all this. So remember, again, when you think about the two, let me just say for now, just for discussion, we have the two groups of food. You have your animal foods, and then you have your plant foods. The thing with the plants, they're naturally low calorie because they're naturally low fat. If you remember what I said, a gram of carbohydrates, because plants are naturally high carbohydrates. So something that is high carbohydrates and low fat is naturally going to be low calorie. Your animal food, on the other hand, because they tend to have more fat, so meaning that because a gram of fat is 9 calories, they're going to have more calories just because they have more fat in them. So when it comes to people that eat plants, predominantly plants, fasting they don't do so much of that because already they're not consuming a lot of calories. You get it? But if you are eating regularly, fasting becomes a kind of a big deal because you are restricting the amount of calories that you're intaking, definitely giving your body time to rest. Personally, I do also practice intermittent fasting, but this is how I do it. Right now, we are talking, in California, it's 8 o'clock. I'm not going to eat again. The last time I ate was 4 o'clock. I'm done. I'm done for the day. So especially if I'm working from home, which I do mostly now, if I'm at home, I will wake up and I'll eat around 9, 10, and then I'll eat again at 4 p.m. and I'm done for the day. Because again, I'm not doing a lot of physical work. My body, I don't feel like I'm hungry. I'm not going to eat, but you will always see me with my water. I'm just drinking water. In between, I do not snack. I don't snack at all. I eat just when I eat, when my time is my time is done to eat, I am done. I walk away from food. So intermittent fasting is very good. It's actually been seen even with people eating regular diet. If they do intermittent fasting, it improves their sugars and all that. It's going to improve your metabolic processes in the body. It's good. But again, I'm saying that if we had more healthier diet, more plant foods, meaning less calorie food, more nutrients, we have more nutrients. Because what I worry with the fasting is if you're going to eat one meal a day, are you going to consume all the vitamins you need? The macronutrients, you're not going to have a lot of problems. Again, you're probably going to eat a mixture of some protein. If you're eating, plant protein, animal protein, you're going to get your carbs and all that. But your micronutrients, your vitamins and antioxidants and all that, if you're restricting yourself to one meal a day, are you going to get enough? So that's why for me, I say at least 2 meals a day. Sometimes you might need a third one, but what I found even personally, because of the level of work that I do, a third meal a lot of time doesn't just sit well with me. When I eat, I just don't feel well rested at night if I eat late into like 7, 8 o'clock. So that's why now I do just 2 meals a day. But my breakfast, I make sure I get all that fruits, I get some whole grain, and then lunchtime I get some beans, some rice, or maybe ugali, vegetables, whatever I'm eating, I make sure that at least I get food from 4 food groups: your whole grains, your legumes, which is beans, lentils, peas, your vegetables, fruit, nuts, and seeds. I do those as well. So it's really helpful. Intermittent fasting is helpful. But I tell my people, if you're doing intermittent fasting, the way I do it, I do it this way because, again, you're going into the night to rest. I don't want you eating to 8 p.m. at night. You're going to sleep. You need rest. Your body needs to be, not digesting food when you should be resting. That's why for me, I'm like at 4 o'clock, I am done. The next time I touch food again, it's going to be 9 o'clock the next day. See, that's how many hours?
A lot of hours of being hungry, thinking about chips. It's sad, but okay, go ahead.
Yes, so it is helpful. I would say by all means we should. This thing of eating 24 hours, you ate breakfast, you didn't eat enough because you've been told to portion and do all these things. And I tell my people, portioning only applies to unhealthy food. If I'm eating my beans, do you really think that somebody will ask me to portion? I can't even eat more than half a cup of beans. It's so hard to portion healthy food. If I'm eating a sweet potato, I eat one, I'm done. Portioning applies to food that is actually, let me tell you, food is addictive. Eating meat is addictive. Let me just say it. It's just the truth. You eat, it's very hard for you to eat just the size of the palm of your hand. It's so hard because of how it interacts with your body, how it stimulates your body and all that. It's very addictive. So I ask my people, I tell them, do this experiment. When you serve somebody food, they have meat, they have vegetables, and they have maybe ugali or rice. What do they go for first? Meat. They will eat that meat first before they eat anything else. Why is that?
Poverty.
So you see, Daktari, like when it comes to, for example, fasting that I'll talk about from experience, and it's a dry fast. It's more than just a losing weight. It's more of a spiritual thing. What it's supposed to teach you and what it actually teaches you is how to discipline yourself from things that are actually allowed and desired, and you have them right there next to you in your refrigerator, but for the next 16 hours, you cannot touch them. So it teaches you a certain kind of discipline. The other thing the other philosophy that we have, and of course not to make this a religious show, that Muslims, we are supposed to be doing, we don't necessarily follow it religiously, is remember back in the campaigns of 2013, Mwalimu Dida, saying that you should portion, your food. That was actually an Islamic teaching he was giving. He wasn't saying it because you're supposed to, for example, kama ni chapati tatu ndo zinakufanya ushibe, you're not supposed to be eating 3 chapos. You're supposed to eat only 1. There's supposed to be a portion for food, a portion for breathing, and a portion for water. So it's usually like 3 portions, and that's how we are told to eat, even after fasting. So, but that's just the break that we give our system after very long periods of just eating. The other one part that I did not want us to lose, I know there's a lot of comments that are coming in here, but the other part that I did not want to lose, there's a lot of people, and I know you're advocating for food, plant-based food as medicine, but there's something called Ozempic. Yes. Yes. Let's talk about it. Let's talk about Ozempic. There's something called Ozempic that is being advertised and has become very popular. I mean, you'll see someone and then you'll see them a few months later claiming that, I've been working out. Oh, God is great. But they've been using Ozempic.
Nilienda Siberia.
Yeah, but they've been using Ozempic. So he kitu to Ozempic, and there are people in the industry who are saying that it is safe. Like if you've been trying to lose weight and you're having a tough time doing it, you can use it. But like as someone in the medical field, what are your thoughts on this, or what is it that people maybe don't know about using this drug? Is it okay to use? Then you can now eat a few plants after taking Ozempic rather than eat a lot of nyama, Daktari.
Right. And I want to say this with all due respect, because I am a trained doctor, and there are situations when you need medication. But let me tell you, medication is not your friend. Medication is not your friend. Only take it if you absolutely need to take it. The other day, in fact, I took antibiotics. I traveled back home. I came back. I had a cough. It couldn't go away, coughing and stuff. Those antibiotics messed me up, my friend. I was just like, medication is not your friend. Just know that. Whatever medication it is, let nobody tell you it's not candy. It's not fruit. So one thing I will say, people are getting on these medications and they're losing weight, and they're going to get side effects. In fact, I had a patient one time who came to the clinic and said they hadn't eaten for 4 days because the medication basically took their appetite away completely. They couldn't eat for 4 days.
And that's not psychological, right? That's just...
It's slowing down. Also, the stomach slows down. So what happens, these medications, and let me tell you something interesting. Mm-hmm. Did you know that the mechanism of action, the way that Ozempic works and those medications, they work on these, they're called glucagon-like peptide. Where they act on, you can actually stimulate the same effect, but it's going to be in a much reduced effect from eating high fiber foods. And guess what? Fiber is only found in plants. You eat whole plants, you can stimulate the same effect of fullness, where you actually eat a little bit and you're like, oh, I just feel full, because you stretched out your stomach. When you ate that high fiber food, it stretched your stomach and it sends signals to your brain that you need to stop. It's satiety, right? So this Ozempic has the similar effect like eating high fiber food, but it's way stronger effect that also slows down your stomach emptying. And some of these people get what's called gastroparesis. Basically, the stomach is just quiet. It doesn't move. And there's so many other effects. You see how these people lose weight. There's even what's called Ozempic face. And I mean, this medications have side effects. And if you're struggling, yes, I do have patients that say, absolutely, I want the medication. Even when I cancel them and I'm like, we need to try the food, the diet, lifestyle and everything. They're like, no, I'm on the medication. I want to keep taking it. But I still do educate them that eat food that are high nutrients then. Because if your Ozempic that you took is making you eat only once a day, then you got to make most of it. You gotta make the most out of the one time you eat. So I do push them and tell them you do need to eat more plants, because again, the nutrient density is higher in your plants and you're gonna get more out of it.
All right, number to call 202-683-4570. Press *5 to speak. So watu wa Ozempic mmesikia, like watu wanafanya hizi vitu, like I think even people sometimes go for certain kinds of surgery to make them, like look skinnier. And I think there's been a lot of confusion between the cosmetic, how you cosmetically look on the outside and what's really going on in the inside. I think there's a lot of focus on how people look outside, and that's why people sometimes are going for these medications where they're not really sure what side effects it's going to have, but as long as it makes them look good, they will go with that. Now, back to the issue, we've talked a lot about diet, like a little bit back to the menopause part. There's something called bioidentical hormone replacement therapy. What exactly is this, and is it a friend or foe when it comes to the management of menopause, Dr. Kaniaru?
Right. So, you know what, just a little bit though about the medication. So the way you want to approach this, like we said, yes, this is supposed to be a natural process, but if you come unprepared, quote unquote, you know, you're carrying excess weight and you're having some mental issues and some stresses and stuff, you know, all that is going to make it much harder, right? So we want to start as early as we can to prepare for this. And not only that, because remember, we are also wanting as much as possible to prevent, you know, diabetes and hypertension. The youngest patient I had with diabetes was 9 years old. They didn't have type 1 diabetes, which is what you expect, that anybody who has diabetes that young is a type 1, which is actually an autoimmune disease. But no, this kid had type 2 diabetes and the kid was 200 pounds at 9 years old, right? 200 plus. So we want to start getting prepared to maintain healthy, you know, weight, a healthy body with low inflammation, with blood, you know, healthy blood vessels, healthy minds, healthy gut. You know, we don't talk a lot about this, but a lot is happening with the gut, and it's called the second brain. You produce neurochemicals in your gut that affect your mood, your cognition, your memory. And guess what feeds that gut? Fiber. And there's no fiber in animal food, I must add. You know, I'm coming back to that again. But so we want to get ready so we can go through this process as natural as possible. But what if everything fails? You know, like I said, pushing for a plant-based diet. But it's not just eating more plants or plant-based diet, decreasing your fat intake, right? We don't want all these fats or these oils and stuff. Actually, in fact, a study was done by a doctor called Neil Barnard. He wrote a book called Your Body in Balance. So women who are listening to me, please, especially if you're in America, you can get it on Amazon. It's called Your Body in Balance by Neil Barnard. So this doctor, he actually accidentally ended up doing this study because he was dealing with this patient who has an endometriosis. And I know you talked about endometriosis before. And that also is a disease that is driven by estrogen and animal product consumption. But okay, we're not going to do that today. Let me just go back. So we're going to make sure that we have healthy bodies, healthy weight, we're eating healthy, but we're also exercising, we're managing stress, we are not drinking alcohol, cigarettes and drugs and all these different things. We are being hydrated and we're getting sunlight. You know, this is one thing that we don't realize, but it's very healthy to get sunlight. It affects our blood pressure, our immune system, our mood. Go outside, get some 15, 30 minutes of sunlight exposure, go walk, you know, jog or do something outside. So getting clean air, trust in God and, you know, faith, social connection is very important, and time in nature. These are all things that we need to have in our lifestyle to make sure that we are staying healthy, right? Mentally, physically, spiritually, you know, all these things. So let's say you try everything and, you know, it's not working and you don't have contraindications. So if you have had breast cancer, if you have had endometrial, you know, uterine cancer, you are not a candidate to receive any hormone replacement because these are hormone sensitive cancers, right? So you're not going to do that. But let's say you don't, or if you had a stroke or you've had, you know, heart attack, these kind of blood clots, you know, blood clot stuff. So you're not going to be a candidate for that. So let's say everything is fine, you can get it, and you're having severe symptoms. This is not something like we were talking about Ozempic. This is not something you're going to say like, oh, yeah, I mean, I can go get it. No, there is a little bit increased risk of cancer when you use hormone replacement therapy. There's increased risk of strokes and heart attacks and these kinds of things. But when I look from a medical standpoint, they do use them because some people are just so miserable that they're like, I'm just willing to do something. I'm willing to do something. Nothing is working. And they say that, of course, there are those systemic ones, oral, that you can take, but sometimes we just minimize to vaginal type, you know, hormone replacement. It does have less absorption and stuff. And, you know, some of these women, like I said, they're having dryness or they're having just pelvic floor issues. They're having urinary tract infection again and again. They're having falling things, you know, all this. So this is something that can be done for sure. If nothing is working and you're miserable, this is something you can get, because again, it's all about risk and benefit, right? Risk and benefit. What are you getting out of this? So yes.
Okay. All right, good. And then there's been so many comments that were coming in. There was one question that Kenyanju was asking. I'm honestly curious if the doc uses any supplements herself, and if so, which ones, Doc?
Actually, I do. Very, very, very good question. I do. I use vitamin D because let me talk about two things. So when you are completely plant-based, there are two things to be aware of. And actually, it's not really very specific about being plant-based.
And
So
then Doc, move you so move a little bit back. We're getting there. You go. There you go. We're good. Yeah.
So vitamin B12 is something that people talk about a lot. So vitamin B12 is made by bacteria in the soil. So you can imagine if we grew our own food, we went and we got potatoes from the backyard and carrots from the backyard and, demand all these things. You want super wash it and all that, and you need 2.4 micrograms of B12 a day. Guess the supplement they make at the store, the one you get from the store that has the lowest, whatever lowest microgram you can get, because you need 2.4 micrograms. The lowest they sell is 100 micrograms. It's almost 100 times more than what you need, 50 times more than what you need. So vitamin B12 is the one that I'm careful with, but I do use nutritional yeast that has B12. I do have B12 supplements. I don't take it every day because, again, you need 2.4 micrograms a day. I can get a supplement that's 100 micrograms. I don't need that much. It's a water-soluble vitamin, so, I can take that. Or if I'm taking like milk, soy milk that is fortified, I can get it that way, or tofu or stuff.
Or maybe an animal product.
Animal product, yes, animal product. But really, be careful with this though, because the animal products, they're also getting the B12 from the ground. They're feeding from the ground. They also, they make some in their colon and stuff, so you can get some from there too. But you also might not get enough, especially if you're taking antacids, if you're taking omeprazole and Pepcid or famotidine, because you need. So you know that. Or if you don't know, you make hydrochloric acid in your stomach, and that acid has several functions to do, like activate your enzymes and kill, microorganisms that might make you sick. But another function it does actually is extracting B12 from your meat, from your animal product. So if you're taking antacids, because a lot of people that are also dealing with overweight and obese, they have acid reflux. You're taking all this omeprazole, you are also not getting enough B12.
Okay.
From eating the stuff that you're eating. So for and metformin, if you're taking metformin, same thing. It's going to impair your extraction and absorption of B12. So for us, people over age 50, especially, we supplement. We tell them you need to just supplement for B12. The other vitamin to be careful with that I take is vitamin D. For some reason, I just not outside enough. Or something. There's something, maybe just North America, being in North America, we just don't get enough sunlight. That when I went to get checked, my vitamin D was 19. So I had to get on a supplement for some time. And I make it a point now to go outside, but those are the only supplements I pay attention to take, because everything else, vitamin C, I eat lots of fruit. Or if it's magnesium, I eat a lot of fruits and vegetables. If you want to get your vitamins from food, please don't get sucked into this system. They're selling us vitamins, a bunch of vitamins. No, you need to eat real food.
Okay, all right. And then Kenyanju is coming hard on you, Doc. Some I think good Doc is conflating things here. Nobody's denying the animal protein industry is off the rails. The pushback earlier was because you were advocating zero animal products. Now it sounds like you've shifted towards moderation. Anavuka sakafu. And then Kenyanjui says, let's not toss in red herrings. If the issue is how animals are raised, the environmental impact and the bastardization of farming, nobody's disputing that. The Kamkunji revolt came up because the doc started from a zero animal diet position. And then Ed Ribui is saying, I was vegan for almost 2 years. I felt really good before I started feeling weak and lost a lot of muscle. Women actually need more protein since they are already losing muscle in perimenopause and beyond. Muscle is such an important organ, and getting enough protein from plants is very hard. That's Edribui. And then Apa Kenyanjui says, Doc, mind a semi-personal question. Has your household bought into your plant-based POV, or do they still sneak in their own choices.
Ule mtu wa chapati.
Yes,
We know
yes.
about
Let
him.
me let
Mtu wa chapati.
Yeah.
Si tunajua, si
Yeah.
amesema.
yeah, let me let Doc answer that.
Sorry.
So let me say something about my kids, because honestly, because I don't buy eggs, I don't buy cow milk, I don't buy meat of any kind, to my house. So no, I don't cook that for them. But let's say we go out to a party, they go to church, they have at school, they have a party, right?
They have ice cream.
They have ice cream. They have cheese
Pizza.
pizza. They do. But guess what? Something that's really crazy. My son, the moment he eats that, he gets home, he's already getting rashes on his body.
Huh.
So
Do you feel guilty for that?
very sensitive to it. My daughter, not as much, but honestly, I don't. I will not, if they're in a crowd, I will not try to control them what they're going to eat. They go have cake, they go have cheese pizza, they go have ice
Meat.
cream. But when they come home, I'm like, no, I cannot. I'm sorry, but I can't buy it. But this is the thing, though. I try as much as I can to substitute. So I always make them nice cream. I actually buy like frozen fruit, frozen strawberries, and I actually make nice cream from that. I just blend that frozen fruit with milk and a little sweetener, and I give that. Sometimes I buy them, non-dairy ice cream. So I don't restrict them so much. And I buy that. I like I said, I make them plant-based mac and cheese. I try to make all this so that they feel they don't feel as restricted. One time my son was like, I want to try meat. I want to see what it tastes like. And we were out, at a party, and I was like, son, go ahead and try it. You know what he said? He said, it's too chewy. I don't feel safe eating it.
Huh?
Well,
Do you sit down with them to explain to them why you don't want them to do, or ni kitu ya mama utafuata?
serikali ya mama
Serikali ya
imesema.
mama imesema na
they-
sikununuli na hauli.
Yeah, there's...
No. I did. I do explain to them, because I don't want them to, like, as soon as they leave the house, they want to eat all they have been missing, So I do explain to them, and I tell them, you can have a substitute. One of the things, honestly, that I've discovered when I stepped outside of Kenyan food, just eating Kenyan food, now I can experiment, make macaroni and cheese, make a lentil loaf, or make, which is like a meatloaf, or make, like all this American type food, but make it plant-based. When I realized that, and then I can do that, that really helped me. So I'm not stuck with, like I said, ugali mboga. They're not going to eat that. They can eat that once, but you put it on their plates again the second time, they're like, no, we're tired of it. So I had to make sure they have a variety, and that's what you get. In fact, when you eat plants, you will find that you have a variety, so long as you're willing to put in the time. This is not something you're going to say, like, I'm going to figure it out in 1, 2 days, 3 days, 1 week, whatever. It took me a little bit of time of learning how to make. Well, I used to go to the store and be like, what is tarragon? What is what is this spices? What is basil? And all this. I have to learn how to use those things. So you have to be willing to learn, and you will find that there are flavors. The flavors are so many that you can try that you will never get bored. I go online, and every time I find something I want to try. I want to try this. I want to try this. Then I can, I can change it like this. I can add this. I can do this. So it's really willing to do it yourself.
So I'll tell you another thing, Doc, and maybe Omosh has been witness to this.
Yes.
Some of us who've been brought up on a certain taste palette, there's certain foods, however amazing the recipe is, we'll go to events and we are just not gonna eat them. It's just that plain and simple.
Mashakura.
Yeah. I mean, I've not mentioned anything, but there's certain foods that, and it's not at
Makande.
it's not at yatutaki kula. It's just that there's a certain taste palette that.
Right.
That we've been, that we've been so used to, and that's why I'm telling you,
Pilau,
Doc,
samosa,
you may have, you might get a very difficult time, like moving people from this palette, which is why I think it may just be better to try to get people to move towards a certain direction, because I can guarantee you there's no sensitization or education that will get a majority of Kenyans to decide we are plant people from today. There's certain cultures, even in India, it's only certain parts of India where they're vegetarian. There's other parts where wanakula nyama kisawasawa vizuri sana. So I think that might be one of those things that you may have to do. And then Kenyanju here said, to echo the caller, thanks to our good doc for coming on. At the end of the day, even if we disagree with her sacrilegious denouncement of Nyamchom, she's just pushing for healthier food choices.
Correct.
And that's the main takeaway, which is very true. And then Ndunge Mood says, every time we snack, we spike our insulin usage and make us insulin resistance, which can lead to diabetes. The less the frequency of intake, the better, especially these snacks za huku like that people have at work, sijui Oreos, chips, nanini, those clearly, those are not good things, but those things are very common, like especially kazini, utwana mtu yani from when wameingia asubuhi, they'll even be surprised. There was someone at work who once asked me, he was like, Ali, I rarely see you eating. And like it's something that I'd never thought about, because hizo snacks za mezani, me at most, I may have maybe nuts. Napenda pistachios. Sometimes I may have almonds. But hizi chips na nini, for some reason, hizo zilinitoka kabisa. And then hapa Christabel anasema,
unakwenda na miogo ya kukaanga hizi snacks.
Kachiri. Hizo hapo pia ni another story. Christabel anasema, somebody had asked earlier, and I'm curious as well, Doctor, do you take any supplements? I think you've answered that question. And then there's Waithira Kathy who's saying, is it possible to be weak and sickly on a strict plant-based diet? Please speak on that. Kamoja Daktari, our time is running out. I'll let you speak on that, Daktari.
So you have to be really remember what I said, that I make sure I am eating from the 5 food groups, whole grains. So whole grains example is like whole maize or corn, whole wheat, brown rice, quinoa, millet, sorghum. Those are whole grains, right? So you want to make sure that you're eating those. You want to make sure that you're eating legumes, which is beans, lentils, peas, those kinds. You want to make sure you're eating nuts and seeds. And nuts, don't overconsume so much, because remember, we're talking about fats. So I'd say a handful or 2. So you want to eat nuts, though. Nuts are healthy. You also want to eat like chia seeds, flax seeds, pumpkin seeds, sunflower seeds. Those are really good too, as well.
Avocado.
You want to eat avocado as well. You want to eat your vegetables, and the vegetables are a lot. Potatoes fall under vegetables. They're starchy vegetables, sweet potatoes, regular potatoes, squash, cassava, yucca, all that. You want to eat all, and you want to eat your greens. Your greens are super powerful. When it comes to nutrients per calorie, they're the most nutrient dense. So you want to make sure I remember growing up and saying skuma. Why do I eat skuma? Skuma is for poor people, and I used to complain a lot. Well, it's a superfood. So eat your greens, spinach, and if you have the local food, local vegetables you can eat. Cabbage is really good, anti-cancer, and so many other good stuff that you can get out of it. Eat your fruit, please. Don't, and again, I wanted to address this here. Do you know actually people get diabetes not because of sugar or carbohydrates, but because of saturated fats, which you have in animal food. You also have a lot of saturated fats in coconut products, so coconut milk, coconut oil, and palm oil. So in fact, diabetes is a disease of too much animal product. It's not a disease of too much carbohydrates. So when you talk about bad carbohydrates, like the Oreos or like the donuts and stuff, guess what they have? That is actually a problem. It's not necessary. Yes, I know it has refined sugar and it has processed flour. The donut is 50% butter. That is the issue. That is the bigger issue because of the thick animal fat. And that's why I say, you all say, why you all confusing us? Why is that a problem? If you look today, after this discussion, because we won't have time to go into it, go and look the effect of saturated fats on insulin. Saturated fats, which is abundant in animal food, make your insulin not to work right. And this is why people get prediabetes and diabetes type 2, because they're consuming too much animal products. So don't fall into this. And even doctors said, everybody, so many people said that when you have diabetes, you need to avoid carbohydrates. No, you need to avoid the bad carbohydrates that also have too much animal fat in them. The carbohydrates you should eat is beans and vegetables and fruit and whole grains. Somebody actually told me one time, they said, well, I didn't know beans were carbohydrates. Remember what I just said. Our body runs on carbohydrates. The macro that we need the most is carbohydrates. So if you look at the animal, at a plant food, and that's why plant food becomes what we need to eat more of, if not just that, because it has a perfect combination of your macros. You need more carbs, but you need them complex, meaning that your body is going to take time to process it. You don't have all these spikes in your insulin, right? You have all these spikes because you're eating naked carbohydrates, which is not healthy.
Okay. All right. Sasa, Bandio also had one quick question before we forget. Bandio.
Doctor, help me with this gel. When you go to the pharmacy to get like painkillers, and you get this gel, and I know some of them are made usually from animal collagen, usually from cows and pigs. I know they have some veggie. Do you go and read and dig to make sure that hauli pig
the liquid gel is not liquid?
Nafikiri like it. So we need daktari bwana.
Well, I mean, my kids used to love like gummy bears, all that. I had to kind of tell them that, this has collagen, this has animal stuff in it. So, I mean, not all the times, but when I have the chance, I'm like, no, you just take, something that's plant-based, something that's vegan. But again, not all the times. I'm not going to avoid it 100% of the time, but I just do my best. But yeah.
Okay. All right. Sawa. So now, couple of comments here that were coming in on YouTube. Also, YouTube hatukuwa sahau. Yeah. So Vikionderi anasema 2 eggs a week. Mimi sitaki mayai kabisa. And then Resilient anasema, wear a CGM monitor, see if blood glucose goes up. I eat 3 to 2 eggs for breakfast. My levels are okay. And then Resilient Father says, use beef tallow for cooking. Stay away from canola oil and palm oil.
Huyo anafikiri oil yake ya kudigest, haidigest mayai. So yanakwenda yanapita tu.
Hapa Resilient anasema, in my opinion, it's the quality of the foods that we eat that matter. Know how to source your food and you will be okay. And hapa Resilient pia alikuwa anauliza is curious about how your AIC levels look
A1C.
like. Your A1C. You'll tell us. And then Misha anasema, thought grass is smoked. And then Misha from Estonia. Misha anasema,
in the timeout.
Yeah, Misha anasema, Resilient anasema, stop eating after 7 p.m. That's it.
Na mimi nakunywaga kahawa na kula chakula at 11.
No.
And then Resilient
hapa nimeshaweka order.
Let me see. Resilient anasema, eat breakfast like a king, eat lunch like a prince, eat dinner like a pauper. And then Resilient anasema, I think you eat dinner past 9 p.m. That's the problem.
11.
Wewe tuheshimiane.
Kwanza
tukitoka hapo unanipeleka kuchukua nini chakula? Oh, sorry.
Mosh hapa alikuwa anasema, I eat when hungry, angry and in love. Didn't I need a time?
Nakula chakula.
Yeah, easy stories are chakula ati breakfast, you eat breakfast at breakfast time. Sijui nini.
Mimi bibi yangu.
Kuja America bana, there's nothing like that. Ukiamka, whatever you eat is whatever you eat. Sasa hapa anyway.
And then Resilient anasema, people want shortcuts so they can go for the drug. Eat right, cut out junk, exercise, enough sleep. And then Misha anasema, seriously, medication is needed to control cancer. What plant can you eat to replace the medicine?
Right.
Amulize Dalai Lama. Dalai Lama alijibu.
No, wacha daktari ajibu.
Daktari ajibu hiyo swali. What plant can you eat to replace the medicine?
Yeah, cancer.
That's actually a really, really good question, because there have been ongoing studies looking at plants that have anti-cancer properties, right? Broccoli and cabbage and garlic and.
Sasa umetuambia broccoli ni fake, lakini sio real vegetable.
Hapana, wewe ndio ulisema kuna sijui hizo gel. Wewe wacha hizo.
Right. So that there are those ongoing studies, but again, they have to really know the dose, right? Can you imagine how much broccoli can you eat? Okay, maybe can you can you extract whatever is in the broccoli or cabbage or garlic, right? To be able to make the drug. So what we are focusing more right now, especially when it comes to cancer, honestly, is prevention, or slowing it down, even when you might even need chemotherapy, right? Or whatever radiation and other stuff you may need. Because like I said, there's ongoing studies. There are people who are really, they believe in plant foods and they refuse. They're like, I'm not gonna get any chemo. I'm just gonna get on a raw diet, right? Just juicing and eating raw plant foods. And some really come out and say, yes, they were able to beat the cancer. So if you are really willing to do that, but what I tell my patients, just, weigh your options, discuss and know what you want, if that's the route you want to follow, but still food can be part of that. Food should be part of that to slow down, even if you have metastatic disease, to slow down your disease. And really eating these anti-cancer foods, mushrooms and broccolis and cabbage and all these, garlic, like I said, all the different foods, you can really help yourself in terms of even if you had cancer, right, and you needed surgery, you needed chemotherapy. So those are things I will say. But when it comes to reversal of heart diseases, that has been well documented. Reversal of diabetes have been well documented with plant foods. And again, remember what I said, diabetes is caused by saturated fats. It's not carbs. And that's why plants work, because again, plants are rich in carbohydrates. Why would they reverse diabetes? Because you took out the saturated fats. That is what happened there. Because once you took that out, it's like you clog up your system. You eat all these fats, they go inside your muscle and liver, they clog it up. Remember, one of us, was it Michael, was talking about when you eat excess carbs and you store them as glycogen in your liver and in your muscle. So when you have all these fats in there, you can't even do that. You can't even intake that glycogen to store, because now you have your insulin doesn't work right, because it's the function of insulin to make that happen, to intake all that glucose in and stuff. So when you clog your system with all these fats, your system doesn't work right. You get diabetes. You get high blood pressure, because when you eat all these animal products with all the compounds that are damaging your blood vessels, that are increasing resistance in your blood, you thicken your blood when you eat all these fats. So your blood is thickened, blood pressure is higher. If you're overweight or obese for the same reason, you're eating high fat foods, and lifestyle, that's you're not as active. So all this stuff, or you're smoking cigarettes and drinking alcohol and all that stuff. So we can tackle high blood pressure. We can tackle high cholesterol. Remember, I said only animals have cholesterol. There's no cholesterol in plants, whole plants. Of course, if you take the plants and cook them in butter, now you've introduced cholesterol that was not there. So we can tackle high blood pressure. We can tackle diabetes. We can tackle the high cholesterol, heart disease, which was the other one, obesity, by really getting into the plant-based diet. And like I said, you don't have to become like me 100%. For me, it was more like a decision, like, how am I going to decide if I'm going to eat it or not? For me, it was just like, I'm done with it. If I don't need it, I know I can get all the nutrients I need from the plant. So I will just work hard to get it from the plant. And one of us said that as women age, they need more protein because they need to maintain muscle. But let me tell you, it's not really that you need a lot of protein. You need resistance exercise. You need to use your muscles. And when you intake that protein that you're intaking, which I tell people, it's about how much protein you need, about 0.5 to 0.8 for regular activity people, 0.5 to 0.8 grams per kilogram weight. So as a woman, you 70 kilograms, you need about 35, maybe to 40, 50 grams, of protein. So we don't need as much protein as we think we do. We need a lot of carbs because that's what runs our engine. And like one of us said, well, if you have excess carbohydrates, you're gonna store as glycogen. And then if you still have excess, you can turn it into fat. But you see that process? Use it up. If you haven't used it up, store as glycogen. And if you fill up your glycogen stores, then you can turn it into fat. But guess what happens to your fat? You eat fat, your body already has carbohydrates to use. what use do you have for it? You have no use for it, except, and I'm not saying there's no use for fat. It cushions, it goes under our skin, it gives our cushion, it cushions our organs and stuff. And guess what? Humans have unlimited capacity to store fat. That's why somebody will become 600 pounds, because my body is programmed to store fat. So tell me about this. If your body has carbohydrates and it has fat inside the body, do you think your body will go turn the carbohydrates into fat when it actually has fat around? No, it's not going to do that. That's so easy. Just take the fat that you have, just put it in storage. Why do you have to turn carbohydrates to fat when you already have fat?
What you're saying is right, but there are experts who say something entirely different. And that's the reason why there's a lot of confusion on the carbohydrates or fats. What is it that's making us fat? What is it that's causing diabetes? There's a lot of conflicting information. Now, before we let you go, Daktari, you've been very kind with your time with us. Maybe assistant anataka sasa spend time na family, but hapa I wanted to know if you are condemned to a desert for a whole year, you didn't have access to any plants, and all you could eat was animals. What animal will you be eating?
A carcinogen.
You're condemned. Yeah, you're in a desert. There are no plants. They're only animals.
That's a tough one. But man, it's a really tough one, because you know what? And before I forget, somebody asked about my A1C. My A1C runs between 5.2, 5.3. My fasting sugar runs about 70. Even with all the carbs I eat, I eat, like I said, but I don't eat processed. I don't eat processed carbs. I eat sweet potatoes, beans, and all that. So I wanted to say that. Man, that is a tough one, because you know why? I have trouble eating fish. I would have said maybe fish, but you know what? What's the problem with fish? Fish is like it's like a dumpster. I'm sorry to say that, but do you know all the runoff that goes to the oceans? I'm just scared to eat anything like coming out of the ocean. Plastics and all kinds of rubbish that goes in there. I'm scared. Maybe a chicken. It's hard to choose, maybe, but I don't want to say I would rather die. Because I would not want to die. You know what I mean? Like it's hard choice to make. But I will tell you, like I said, I would not even feel safe with fish. Maybe I would say chicken. But a free-range chicken.
A free-range chicken in the desert. Kuwa serious bana wewe.
Basi nitakufa. I will die. I will be dead. But I have lost taste so much. But again, nobody wants to die. So maybe I will just eat the chicken. But I'll tell you that it's really hard to choose when it comes to animal food. Even when I used to eat animal food, I couldn't even stand eggs. The smell, everything about eggs, just no, I'm not. And I know you're not talking about eggs, because you just wanted to know about the animals. Milk, I was a fan of milk. I used to drink at least a cup of milk a day because we had cows. So that, after a while, I kind of lost. If I try to drink it, the smell comes, kind of now I'm used to the way I eat. But I would say it is tough, but maybe I'll go for chicken because I kind of have to make a choice.
Oh, yeah.
But, yeah, it is tough. But what I want people to get out of, because I know we're running out of time, please just know that, yes, there are many schools of thought. There's so many things, but I asked you honestly, if you were to think about it, how we grew up, how we ate more, because quote unquote, at least for me, we were poor. We would eat greens and ugali and rice, beans and all that. But we didn't see as much disease as we see now. And even though people may say because of the seed oils and stuff, yes, seed oils are a problem. That's why I personally don't use them. But I also want you to consider that the number one cause of death in the world is heart disease. Do seed oils drive heart disease? No. Cholesterol drives heart disease. And cholesterol is only an animal product. So our animal product consumption has gone up super high. So how about we go back to the 2 pieces of meat that we ate once a week? If we really wanted to eat it.
2 eggs a week, 2 pieces of meat.
No, alisema 2 eggs ni mbaya. Sasa anasema 2 hapana huyu.
Who was eating 2 pieces of meat?
No,
but I
no,
say, I tell people this.
Ilikuwa ni Sundays only.
growing up. She said growing up, being poor.
Growing
Sasa
up,
ni
you know,
hiyo.
growing up,
Yes.
that's how we did it. And if we had biscuits or whatever was once in a while, if we had sweets, you know,
Yeah.
if we had soda, it was once in a while. So if at least we were like that, because if you think about it, we were doing more in terms of exertion. We are exerting more. We are not eating all this junk and all these foods. We are not eating like that. We are less active. So there's so much pollution, there's so much stress, there's so many other things that are working against us that we need to really pump more plants, because like I said, plants have protective compounds. That's why we have to eat more of it, even when we say that, well, maybe our forefathers didn't eat as much as we are recommending, and they were quote unquote okay, but they didn't have the, you know, when you have stress, the inflammation you have, so you need more antioxidants to fight the inflammation that's going on in your body. So you need more plants.
But also, Doc, how do you explain that people are living longer? You know, like in a very long time in history, people are living to their 80s.
90s.
To their 90s.
Yeah.
So that's why this sometimes is a bit confusing, you know, because with our ancestors, you know, like life was nasty, brutish and short. Yeah. You know, like ulikuwa nafika 50 unaitwa mzee.
And you're right, because also, you know, the hard work and everything, being outside so long. But you know, especially in America, because I see a lot of patients, they are living, yes, to be in 80 and 90, but a lot of them are coming with a bag of medications. So we're really having a real issue. Yes, we can make more medications, but you know what is happening? And I want everybody listening to please go do your research. AI is so good. Go do your research, please, because there's doctors now solely into lifestyle medicine, because we are realizing that our health is not getting better by making more medicines. We need to tackle lifestyle, because that's the foundation of our health. Because actually it has been shown that about 80% of the diseases we have are preventable or reversible if we changed our lifestyle, starting with the food. So now our doctors will still have work, but with only 20% of the outliers, the people who, you know, still will get sick no matter what you do, or they will not listen, they will do whatever they're doing. But if more of us are doing the same thing everybody's doing, guess what? You know what they're predicting? That by the year 2030, half of Americans will be diabetic. Right now, a third of Americans have diabetes, and you know, that's a third. But about close to half of us, about 40%, if you add the pre-diabetes. If you add pre-diabetes and type 2 diabetes, we're about 40%.
Okay. All right.
So,
no, Maliza, Doc.
So we just need to change our lifestyle, change our food. And like I said, yes, we can say we need to eat more clean food and everything, but we also need to realize that there's a reason why heart disease is the #1 killer, because cholesterol is it's an animal product. And we make all the cholesterol we need. Our liver makes all the cholesterol, because people argue with me about this all the time. Well, but you need cholesterol to make your cell walls, to make hormones. It makes your testosterone. It makes your neurotransmitters and stuff. I'm like, yeah, it makes your vitamin D. You need cholesterol. But your liver makes all the cholesterol, that you do not need to intake cholesterol from your diet. So we need to work with our body so our body can work for us. And like I said, we don't have to be extreme like me. For me, I don't consider it extreme, because now I'm used to this lifestyle. But for a lot of people, I just encourage you. How about you go 50%, 60%, you know, of your food is plants. Go to 80%, go to 90%, go as high as you can go, and see how your health responds, right? So then it's not just me talking. And just like I said, please, let's not get misled by experts. Let's use our common sense. Because if somebody comes to me and tells me fruit is bad for me because sugar is sugar, it doesn't matter where you get it from, that, oh, you know, the table sugar and your fruit, they're all sugar to your body. They're not all sugar to your body. Your fruit has antioxidants and phytonutrients. It has fiber. It has minerals and vitamins. It's not the same as table sugar.
But now you see, Doc, also, as we wrap up, I'll also tell you, you know, like there's someone, even a nutrition expert, when you say that fish is not good,
right,
they will also completely
Sasa hiyo
disagree with you.
Mimi ya fish inafananisha na nyuki, you know what bee wanakula kuja kupata asali.
Yeah.
So,
Lakini mimi ninawauliza tu swali tu as we wrap up. I asked you, if you were to choose, like you're asking me to choose, there's a food, any whole plant you eat has complex carbs, has protein, fats, vitamins, minerals, fiber, antioxidants, phytochemicals, water. That's any plant you eat. Choose it. Broccoli, spinach by itself. It will give you all those. It's just in varying proportions, but it will give you all that. Avocado, nuts, each one of them will give you that. And then you go to your chicken or your fish. There's no fiber. There's no phytochemicals. There's no antioxidants. There's no vitamins. So how do you tell me, even a nutritionist will stand and tell me that that's actually a healthy food to eat, a complete food to eat?
No. But I think, Doc, also you're missing the point. There's no one who said it's a complete food. But right. I think when you like say, an understanding, like there's a lot of people who eat fish right. as an option of and they're not only eating fish. They'll be eating right. fish. They'll be eating, like carbohydrates. They may have also some greens there. They'll have different things. But I think where, Doc, you will experience a challenge. I mean, you go to Nyanza and say that, and when you think about it, they have, a freshwater lake there where they get their fish from. And then when you go say that over there, in all honesty, I think no one is gonna listen to anything that you say after that. And that's where I'm saying there has to be care in how right. this is done. Remember, the optimal path, so your 100% plant-based option is the optimal path. But because someone will collapse after the third day, then that becomes a bad option for them. Because right. when they collapse out of that, they will go double down on what right. they were doing before. So I honestly think a better approach is because honestly, like when we say fish is bad, eggs are bad, milk is bad, then we are entering we are going to be entering a very problematic zone. But anyway, Bandio,
I understand. I understand, Ali. I understand totally what you're saying, but and that's what I was trying to say. That how about then we go back the way we used to do it? And I tell people it's a maskini, like kula kama maskini. Then fill your plate with the greens. Start with the greens, because I tell people I have yet to see. And I've seen this. I'm not saying I absolutely haven't seen it. Somebody whose plate has more vegetables than fish or than chicken and meat and all that. If we were to discipline ourselves like that, maybe then we can start talking and not do it every day. But the way we do it, mimi chenye ninaona, somebody has a whole fish, tumboga, na sasa because carbs are the enemy, the ugali is almost non-existing, right? So that is the problem we have, that now we have demonized carbohydrates, even the good carbohydrates. Now we want to eat more protein. And you know what? I talking about the Luo people. Actually, they're better off eating their fish, because you know what? For them, they eat it fresh. Do you know the problem we have? They take that fish from the lake and they deep fry it, and you get it in Nairobi deep fried. You lost the benefit of that fish. Even because really the big benefit you get from eating some of this fish, the oily fish especially, is omega-3. You take that fish and you deep fry it, you lost it. Because now you have actually introduced a lot of omega-6. Omega-6
Gandhi, the fresh one.
That fish that is deep fried over there in that oil
by the Wamama.
Yes. Yeah. That oil that has been used for 48 days.
Yeah.
Boss, that's okay. The best fish.
Apa Kenyanjua anasema, I think we should wrap up by giving Doc her flowers. At the end of the day, she's a healthy lifestyle advocate, and I'm sure she couldn't care less how you get to the healthy finish line. Thanks, Doc, for your advice. Bandio, wahenga wanaelezaje?
Wacha kwanza ask one more question for Doc, please. So
Okay.
this is
The last one.
last question.
Yeah.
And this is on YouTube. I say Omosh Ebu Lisa, this new craze of nitric oxide and its health benefits, and where do we get it in food?
Yes, actually, I really love that because nitric oxide. So inside of your blood vessel, you have what they call endothelial cells. So it's like a thin layer of cells that produce nitric oxide. And what nitric oxide does, it basically dilates your blood vessel. And a dilated blood vessel has good blood flow, right? Like just a nice open pipe, right? Blood flow is going. You can actually get nitric oxide through other ways. One of the ways is sunlight. When you get exposed to sunlight, you can get nitric oxide, but also by eating greens and beetroot. So you've probably heard about that, but your greens, when you chew them, they produce these nitrates. They create the nitric oxide that keeps your blood vessel nice and open. And that's why, the greens are really powerful when it comes to maintaining a healthy cardiovascular system.
Sawa, asante sana.
Haya, Bandio wahenga.
Kwanza tuangalie Muturi kama yupo Uno.
Huyu
Wahenga walinena kilicho na mwanzo hakina budi kuwa na mwisho. Meli imetia nanga. Let's wrap this puppy up. And what were you about to say? Alichunga sana.
All right.
Wewe ndo uchunge.
Ameshadondoka Mika, so
Yeah.
2029. Almost.
Yes. Daktari, asante sana. Thank you for gracing us with your presence, for making time. I know kuna hapo ka time difference kidogo kiasi, but at the end of the day, something that I'm gonna, I guess, paraphrase what Africana Voice says that you're a great guest. Doc has started a great conversation with the community, especially for those who are meeting her for the first time. And they want us to invite you back for another session focusing on diabetes. Okay. I tend to agree with Africana Voice on this one. And all in all, at the end of the day, you are an advocate for a healthy lifestyle journey. And we get it. We understand it. Some of the stuff that you're saying may be, I guess, painful for us to take. And I think what Ali was trying to say politely was, give it to us in small doses, tuanze pole pole ndio tuone vile tutafika huko kanan. So we thank you. And with that said, I'll say to our audience, tuonane wiki jao. Have a good week. And watu wa East Coast, enjoy this weather while we still got it. Asante.
Okay.
Thank you so much. This has been amazing, and I look forward to coming back again. And thank you for all the questions. I actually really enjoyed them. And let's keep it real. Let's keep it real. And what makes me really sad is we seeing men drop down. They have diabetes, drop down dead at 50. And I don't want it to sound dramatic, but I want you to be very aware that these are stuff we used to see later in age, but it's becoming younger and younger for our men. We don't know what happened to them. They were just found dead. No, we want to prevent this. We don't want people getting heart attacks at 40, at 50. And let's talk next time, diabetes and anything else you want to talk about. But if you will meet on Facebook, I actually do respond to all the questions you have there, and we can keep talking over there as well.
Asante, Daktari.
Okay. Asante sana, Daktari. Thank you so much, DJ Moshfire. Uno Mike, Mika has dropped away, na Mubelo Bandio. It was a very amazing episode. It's Washeke's daughter's birthday. Now we forgot to wish her happy birthday. So
na kesho ni Annette's son, right?
Ni birthday. Yeah, so watu wenye mabirthday bumu ziandike hapo tuzijue. Wow. But back to
Washeke's daughter is Sunday.
Oh, Washeke's daughter is Sunday. Okay. Haya, sawa.
Nafikiri Annette's is tomorrow. Annette's son is tomorrow.
Okay, yes. It's tomorrow. So happy birthday to all.
And Jerry is on Sunday.
And mine
Monday.
Jerry
is Monday.
Mine was last week, and I never got any cash ups I got nothing. So
we wished you a happy birthday.
Trump crypto yake.
Yes. But we did wish you a happy birthday.
Okay.
Or you are saying you still wanted to be blessed with money.
No, cash up. I'll give you guys.
Change to a plant-based diet.
But that's yes. But Uno, that's not halal, right? Isn't it? Nini, he can't accept money.
That is more halal.
No, that's a gift.
Itself.
No, cash up hiyo ni gift hiyo hapo. Hiyo hakuna nini. Hiyo si riba. Riba ndo iko na problem. Yeah. Riba ndo iko na problem, but zawadi unanipatia, unaona nimesota hivi, unaambia Ali chukua hiyo $100 hiyo hapo ndo kajisaidia, unakaa unakiu sana. Those are the things that we'd like to see. But again, like
broccoli.
Yeah. Thank you so much. Thank you so much, Doc, for coming through. I mean, of course, there were some hard truths that we needed to hear. But the one thing that I will keep telling you, Doc, and this is from, because you're an expert in what you do.
Birthday perspective.
Yeah, you're an expert in what you do. But in my experience, both in personal finance and also being, like an account executive where you're responsible for convincing people to either buy certain ideas or buy certain things, it will be very, very important for you, Doc, to not knock these hoods the way you knock them. I can guarantee you something. There is no way, no matter what advocacy you do, there's no way people in Kisumu are going to stop eating fish. It's not going to happen. So you have to start from that perspective. Ukija Pwani, there's no way we're going to stop using coconut, in our food. So you have to start from that perspective. And I think that is a very important aspect in as far as winning people, to get people to buy into that idea of increasing the portion of vegetables they eat, increasing the portion of the plants that they eat. And then, of course, ukienda Murima, there's no way you're going to tell them to stop eating nyama choma. It's just not going to happen. It's not going to happen, but there's a way in which you can convince them, mnaweza kuongeza hii na hii na hii, and that may be a better way to go by. Remember, the best path to follow is never the optimal one, but it's the simplest one. That's one thing that that's one thing that I came to learn the hard way in my career. When you give someone the simplest path that they can follow, they are much better off than forcing them to go on the optimal path, because that optimal path is the one that you will most likely deviate from. So Kenyanjui hapa naona amekuwa convert, but Kenyanjui, if you get excited and start a plant-based diet tomorrow, I can guarantee you, before the middle of next week, you will be suffering withdrawal symptoms, and you'll be busy, like eating all kinds of nyama choma, sausages, and all other kinds of crazy foods that we normally eat.
Ali, usiwa discourage watu. Mimi nilipoamua ku quit cigarette, actually I was sitting there and I was like, I'm done with this. When I decided to quit red meat, nilikuwa nimekaa tu. Na mpaka leo bado napikia wengine.
Yeah.
You're like, so to me it's like, unless you made a decision just from hearing this show and you didn't get time to think about it, marinate, kutafakari, but if this is the starting point, and you go do your digging and think about it, the pros, the cons and everything, you come to a conclusion, it's like, maybe I don't need this.
But the other thing that Bandia that also needs to be resolved is all these experts need a conclave, because there's a lot of confusion.
Yes, they are all telling us different things.
They're all telling us different things. And now,
carbs are not good. Proteins should be good. In case you look at an egg, the egg might beat you. If it beats you, you'll be dead. If you're not dead, you'll be alive. The donkey went up a hill. I don't know.
As long as that conclave is not led by JFK, the health secretary.
RFK Jr.
RFK.
I know that we were kind of done, but let me say actually something a little about the egg, because this comes up, and because of now what's happening. Oh my goodness. I have seen several people eating 3, 4, 5, 6 eggs a day.
Yes.
Because now, we've been told it's perfect protein and everything.
Yeah.
But the egg, just think about it. What is coming out of an egg if we actually really let it go through the
Unborn
process?
chicken.
It's supposed to be, it's a chick that comes out of it. And everything that is in that egg is nutrients enough to make the chick. And the cholesterol in that one egg, let's say, for the purposes of this discussion, the amount of cholesterol, the daily allowed cholesterol, so to say, even if you were to eat it. Remember, I said your liver makes it, so you really don't need to eat it. But let's say, okay, you're eating it, it's 300 milligrams a day.
Okay.
Guess what? One egg is 200 milligrams. So you already, even if you eat 2, you already exceeded your daily cholesterol. And now leave that, because you ate egg and then you ate meat. Now you got more cholesterol. Maybe you ate something else. You know what I mean? Like, the egg is perfect. You need that cholesterol to make all the cells for that chick. You need that protein, that what we call complete protein, for that chick to develop, for its nutrition. So these kind of nutrients we don't need in our body.
Okay. Right. Yeah. One last thing, Doc. One very good strategy that I saw by also a doctor that I was seeing who's also, has some nutritional training. What they did was, before telling me that this is bad and that is bad, they asked me, like, give me a sample of your diet, like any week sample, show me what you eat. So nikaenda nikamwandikia. So he went, studied it, analyzed it, and then took the good foods from the ones that he felt were good for me and double down on them. And I think that he was able to convert me, he was able to convince me to eat less of certain other foods that I was eating.
Because he made you feel a little smarter.
Because food is very emotional, it's very spiritual, it's very cultural. People are not just gonna quit because someone said so. That is the uphill task that you're gonna have, daktari. But asante sana. We really appreciate. There were some hard truths that we had today. Na kwa hayo machache, yote ambaye anataka kunipigia simu, nambari yangu bado ni ile 1-800 mteule. Na operator akishika simu, mwambie unataka kusema na mjukuu, na akikuuliza ni mjukuu yupi, mkumbushe ni mjukuu yule wa Masai, because I'm Kenyan by blood, American by design, Masai by choice. Sichagui, sikagui na sibagui. Kwaherini.
Asante sana Doc kwa kuwa nasi. All the listeners, this was fire, and that's what we want. So asante sana kwa topic. Uno, shukran. Hope to see you come out to show up next week, which is not guaranteed, but
no guarantee.
Yeah, so that's okay.
Slim chances.
Yeah. Yeah, the chance is close to none.
I check it too.
Just give a mosh eggs, you'll be fine.
Alright, kwa sikilizaji wetu wote, shukrani sana. Mimi naitwa Mobelo Bandio. Hadi wakati mwingine. Mamosh, unakwenda kuspin?
Ama ni time ya.
I can play a quarter song.
A quarter song.
Alright. Yeah. Asante sana Doc.
Sasa ile chicken after show tutakula ama hiyo sasa tuanze ku
we were told no more chicken, no more eggs, nothing. Eat a plant.
Umeshaambiwa no chicken na umeshaambiwa hakuna kula nyama.
Okay.
Yeah. Kula majani na usile kuku, kula mayai.
Okay.
Twende kazi.